morning, everyone. Good morning. Good morning, good morning. My name is Joaquin Esquivel. I'm chair of the State Water Board, and I just want to welcome everyone today. It may not seem obvious, I think, for some people, obvious for you because you are here, but for some people, why the board would be interested in homelessness issues, or what is our sort of role, or why we would convene this discussion today. And as all of you, I think, know, but for those that don't, of course, California was the first state in the nation to actually have a human right to water. And in 2012, that was passed, and so much of the time these last years has been filled with how to actually make that real. Because while it is certainly a high and lofty goal, the specifics of what makes the human right to water real are varied. And as we know, the basis for the human right to water is access to clean, safe, affordable water for the purposes of drinking, cooking, and sanitation. And obviously, Governor Newsom, myself, this board has been very focused on how do we fulfill the drinking water portion of that human right to water. It is the most, sort of the strongest imperative that is in front of us. But sanitation is also equally important in that whole equation. Whether we're talking about communities that are mainly on septic perhaps, and are then having water quality impacts because of their lack of access to centralized sanitation, or in today's case, homelessness, where a lack of access to sanitation by our homeless communities means spread of disease, means water quality impacts, and so it does actually have somewhat of a fit, and it is something that we are obviously very interested in trying to continue to convene a discussion around, flesh out further. I have to thank Laura and the Pacific Institute and ACLU, because it was actually the report in April of 2018 that tried to quantify how are we doing on our our progress on the human right to water, and really identified the lack of a conversation even around the sanitation component, where rightfully so, drinking water again is a huge priority, and we're driving hard on that now. But it's also time to maybe start to flesh out and have a discussion around how do we fill that sanitation component and what that looks like. So really thank everyone here today for being interested. This is actually also kind of a follow-up to discussion that we had at our Water Quality Coordinating Committee, which is in the Water Code, a yearly meeting that is dictated to happen between all the 9 regional water quality control boards and the State Water Board to discuss water quality challenges statewide, to coordinate with one another. And sanitation was actually one of the focuses, and that was chosen by the regional board members. It was by committee. So this is obviously something that I know has been important, continues to be important to many of our regions. We, at that time, heard from Mayor Faulkner and all the great work that is being done, and leadership as to, because of the crisis that we saw in San Diego around the Hep A outbreak, how to kind of get our hands around this. So again, just thank you all for your expertise, your time, your commitment here on a Friday to talk about something that's actually pretty critical when it's difficult sometimes. The human right to water, it seems so obvious, I think, to most Californians. Like, of course, I have access to drinking water. I have access to sanitation. I've never been challenged by those things. How is this a problem? But we know it's a problem. And so it's incumbent upon all of us to remember that, anyway. So thank you all really for your time today, and look forward to the discussion. I'll be here listening with you all for the majority of the day. So thanks, and with that, I'll introduce Max Gomberg. When I asked Max what his official title was right now, I realized it is basically guru of everything. So we thank Max for his attentions here as well, in emceeing things and moving things along. So thanks again.
Thank you, Chair Esquivel. Welcome, good morning, everyone. I'm Max Gomberg, guru of many things here at the Water Board, including some of our broad work on the human right to water and affordability and access to sanitation, which is what we're here today to talk about. And I want to note that in addition to all of you who are here in the room with us, we're webcasting, and we have over 100 people watching on the webcast, so we're making sure we get this information and this discussion out all around the state. I want to echo what Chair Esquivel said. This board, we take the human right to water law very seriously. We're working hard to implement it. And as he mentioned, there are many dimensions here when we're talking about access to safe and clean water, to accessible water, to affordable water, and that's for all uses, including sanitary uses. So this is a big challenge. California is alone among the 50 states in terms of passing a law that says we are going to affirmatively take on this challenge of human right to water, and we're working hard on that. So today, we're here to listen, we're here to learn, discuss, explore ideas for what roles our 10 organizations can play. For those not familiar with the water boards, this is the state water board. We're the central headquarters agency in Sacramento, but we have 9 regions around the state that are also responsible broadly. Those 9 regions are mainly responsible for water quality, whereas here we have responsibilities in a portfolio that spans financial assistance, drinking water, water rights, and other programs as well. I also want to note that in the state's human right to water legislation, not only this board, but our colleague agency, the Department of Water Resources, is also charged with helping to implement this law, and I know we have colleagues from the department here with us as well today, and we appreciate their participation. We've got a fantastic set of speakers today, researchers, public health experts, local governments, NGOs, and others who are working on the ground at a local level with people who are unhoused and unsheltered, providing services. And we're going to have a really good set of discussions around what are those efforts at the local level, how are we funding them, and more broadly, what policy roles and other assistance roles can our organizations play. We'll also have representatives from the state's Homelessness Coordinating Council, which is responsible for distributing money that the legislature has appropriated for homelessness services. And I do want to note, for those who missed it, that Governor Newsom was in San Bernardino earlier this week in a roundtable talking about homelessness services, and did note that he will be proposing additional money in this year's budget for homelessness services. So finally, before we start the program, I just want to note, and again, echoing what Chair Esquivel said, it's easy to take access to sanitation for granted when we're talking about toilets, toilet paper, water, soap for hand washing, showers. It's really easy to take this stuff for granted, but a lot of people around this state don't have that access. That's why we're here today. So without further ado, I want to introduce our first speaker, Dr. Laura Feinstein. Dr. Feinstein is senior researcher with the Water Program at the Pacific Institute, which is an Oakland-based research organization specializing in sustainable water management. Her research focuses on access to drinking water and sanitation for disadvantaged communities, the water energy nexus, and more broadly, California water policy. Prior to joining the Institute, she worked for the California Council on Science and Technology. She also worked as a fellow for the State Senate for the Environmental Quality Committee, as well as being a Sea Grant Fellow. She holds a bachelor's in anthropology from UC Berkeley and a doctorate in ecology from UC Davis. Dr. Feinstein.
I'll just wait until it comes up. Hi, everybody. Thank you for joining us today. Really appreciate you taking the time to be here. My name is Laura Feinstein. I'm with Pacific Institute. And I'm going to be talking to you about water and sanitation in California today, touching, of course, specifically on the issues that face persons experiencing homelessness, but also trying to frame it within the broader context of the challenges that the population as a whole faces in accessing water and sanitation in the state. Quickly, Pacific Institute is a nonprofit research organization. Our goal is to produce research that advances a sustainable environment, a healthy economy, and social equity with science-based solutions. And we have put out a number of publications recently that you may be interested in referring to. I'll be touching on some of the highlights throughout the presentation. One is Measuring Progress Towards Universal Access to Water and Sanitation in California, which grapples with the question, how should the state define, measure, and track water and sanitation service in its efforts to implement the human right to water? We also are coming out in the next couple of weeks with a report called Plumbing the Depths on Californians Without Toilets and Running Water, which asks the question, how many Californians lack access to water and sanitation, either because they are unhoused or because they have incomplete plumbing in their home? And we also recently came out with a policy brief focused specifically on Alameda County and strategies for achieving access to sanitation and hygiene for individuals experiencing homelessness in that area, which focuses on how local governments can better provide these types of services for those who are unhoused. I'm going to frame the bigger issues for you today. I'm going to give you some background on water, sanitation, and hygiene, and then talk specifically about Pacific Institute's ideas about how to define water and sanitation service and what that means and how to track our progress in California. Then talk about some data, who lacks access to water and sanitation presently in the state, and then wrap it up with some policy recommendations. So first, the background. So what are drinking water, sanitation, and hygiene? We'll start first things first. So drinking water, we define that as water for indoor domestic use. So borrowing from the California Water Code, the section on the human right to water, that is water for consumption, cooking, and sanitary purposes is how it's defined. So this is not the water that you use outdoors to water your lawn. It's the water you use for your basic everyday needs indoors. Sanitation is a toilet and the infrastructure and management for safe disposal of human waste and wastewater. So it doesn't necessarily include the clean drinking water you're using to flush that toilet, but it does include the wastewater that it exits and whether or not it is safely either treated and discharged to the environment or reused. And then hygiene refers to a facility for hand washing accompanied by soap. And this is a term that isn't used as much in California policy, but this is a standard sort of international framing of the ideas around water, sanitation, and hygiene as these three pillars for sort of reducing bacterial load in the environment and making sure people can have reach their full, human health, ensuring human health, I should say. So why do we care about clean drinking water and sanitation and the nexus between the two? So this is a chart showing causes of death in the United States in 2010. And these days, the United States is essentially a country of people that primarily dies of illnesses of old age. The average age in California is 79 years. And the leading, or not California, the United States is 79 years. And the two leading causes of death are cancer and heart disease. Most people live to be older, and the illnesses that we develop are illnesses that you develop over a lifetime that may be exacerbated by chronic exposure to problems such as unsafe drinking water, poor diet, your genetic dispositions, etc. What causes of death look like now are very different from what they looked like at the turn of the 20th century. So in 1900, what you see, first of all, is that the mortality rate was much, much higher. Per 100,000 people was about double. And that specifically the causes of death were very different. So one of the leading causes of death in 1900 was gastrointestinal illness. So these were the types of illnesses people contracted from a lack of access to hand washing, a lack of good sanitation in the environment, a lack of drinking water that was cleaned of human pathogens. So there was a constant bacterial load in the environment. People were constantly contracting communicable diseases and often died from them, many of them at very young ages. The majority of people who died of gastrointestinal illness were under the age of 5. So this has been a tremendous public health victory in this country and in the developing world more broadly, is being able to live in an environment with a very reduced load of human pathogens around us. And we've accomplished that with with drinking water that's cleaned of human pathogens, largely with chlorine, with centralized wastewater that removes all this waste from our environment, and access to hand washing facilities. One kind of interesting study that came out a few years ago made this link not just between access to sanitation and public health, but also specifically between access to public sanitation, clean surface water, and its impact to public health. So of course, we're talking here about the human right to water, but there's also a nexus between sanitation and surface water quality. So what this chart, rather complex chart, is showing you is that in the county of San Diego, the San Diego Water Board took a look at this problem that they had of excess coliform, basically bacterial load in their surface waters. And they assessed the costs and benefits of a few different approaches for remedying the problem. They took a look at the possibility of altering how they were doing their monitoring and changing the times of year they were testing for coliform in the waterways. They took a look at the possibility of doing stream restoration so that the riparian environment could process the bacteria and break it down before it got into the streams. And then they also assessed the possibility of fixing leaking wastewater pipes, leaking septic systems, and providing shelter to the homeless in the area. And what you're seeing here is that there were 3 different levels of intervention they looked at in terms of preventing human waste from entering water in the first place, but all 3 of them far and away outperformed any other method of intervention for improving surface water quality. So the takeaway from this is that the best way to get improved surface water quality in the San Diego County area was to prevent human waste from getting into water in the first place. Fix your wastewater systems and make sure that homeless people living near waterways have access to shelter and therefore also to toilets. But I think one thing that is a bit of a tension between this sort of new way of starting to think about water and sanitation as a human right and the old framework that we have in place in this country is that our whole regulatory and statutory system is set up around this idea that the way we deliver clean drinking water and effective wastewater services in this country is by ensuring that we have good centralized drinking water and good centralized wastewater services. And most people are served by those, live in those areas. So if you have a functional system and you live there, then your drinking water and your wastewater are fine, is sort of the assumption. And this is effective for the majority of people. 96% of Californians do live in an area that's served by a public drinking water system. And so we regulate the drinking water systems through the Safe Drinking Water Act, we track their progress, and then we assume that if you live in that area, then your water is clean or not, depending on whether or not they're in or out of compliance. And so this map is just to show you that framework of thinking. This is the State Water Board's Human Right to Water portal, and what it's showing is a dot for every public drinking water system in the state. If it was presently out of compliance as of early 2019, it's marked in red. If it was in compliance, it's marked in gray. But the challenge or the fallacy with that framework is that it doesn't think about problems or barriers to access that happen at the individual and household level. So what this is depicting for you is a drinking water or wastewater service area that has a number of connections to different types of households or public facilities. So first, at the very top, you have a household with complete plumbing. So this is a household that has a toilet, it has an indoor sink, it has all the basics that are required under the California Plumbing Code. It's a livable domicile. And people have, assuming that the drinking water and wastewater service here is good, then they have good drinking water and wastewater in their home. They have full access to water and sanitation. But then you have other issues that arise, and one thing we hear about, which we won't talk about in detail today, is premise plumbing quality problems. So you have poor plumbing in your home that leaches lead or copper or other contaminants into your drinking water. So the water coming from the system is good, but the water you're drinking is not necessarily of good quality. You also may have a household with incomplete plumbing. That can mean a number of different things. Sometimes this is, for example, someone living in an RV with a toilet that's not hooked up to centralized wastewater. It could be somebody living in some standard housing, like a garage. This happens in a lot of high rent areas. People rent out some kind of shelter that isn't properly equipped with a sink and with a toilet. Another challenge that I'll touch on a bit later is single room occupancies, where a large number of people are sharing a single toilet, and there can be maintenance and cleanliness problems that render them unusable. So for various reasons, there are people who have a roof over their head, but their plumbing is not actually connecting them to the service, the wastewater or drinking water service, and therefore they lack full access. And then what we're focusing on today is this last group of people, the public drinking fountains and restrooms. You don't actually see my arrow up there. I'm just gesturing to nobody. So the last box here at the bottom is public drinking fountains and restrooms. And this is a primary place of access to drinking water, hand washing, and toilets for persons experiencing homelessness. And so this is the major breakdown of service that we're going to focus on today. And we'll delve into a little more why it is that public drinking fountains and restrooms often don't provide the level of service that people need. So moving on, we're going to define water and sanitation service in California. So for this work, this is largely drawing on the Measuring Progress report, which is about how do we define and track water and sanitation in California. What do we mean by these terms that seem a little bit squishy to wrap your hands around? So we approach this problem with a bit of an international mindset. The United Nations and World Health Organization have for years now been tracking progress towards achieving universal water and sanitation with what they call service ladders. And this is essentially their compromise between the fact that there's a lot of complexity in the types of drinking water and sanitation service people experience. It's impossible to wrap your arms around the full range of complexity, but at the same time, they didn't want to go to such a reductionist system that they were saying either your drinking water is good or it's bad. So the compromise is come up with a service ladder with a handful, in this case 5 rankings for water, 5 rankings for sanitation, and 3 for hygiene. So you can track incremental progress over time, and you can see some of the range of variation without an excess level of complexity. So what this sort of then enables them to do is to track these bigger patterns and trends and to see whether or not they're on track to achieving their goals of universal, they aren't aiming for universal top level water and sanitation. It's something like reduce those doing open defecation by 50%, et cetera. They have a number of incremental goals that they're aiming for by 2030. And they track them through these regular reports, and they can produce these maps showing who's covered with what level of service in the world. And what you'll notice is that the United States always looks like it's doing great, because the standards, quite frankly, internationally are not really the standards, first of all, that we would think are acceptable. So things like safe drinking water internationally is just, does it lack bacterial contamination and I think fluoride. So they aren't concerned about, for example, lead or copper or a lot of other things that we would worry about. And they also don't drill down into the level of detail that we are going to into some of the really marginalized populations. They tend to kind of look at, census data, and if you're at 99%, the UN says good job and moves on. So we're going to drill down a little more because I think, we're in California and we're going to focus on that last 1 or 2% that we need to serve. Service ladders is a very useful framework, and it's been applied in many different contexts. In addition to being used as the bigger tool internationally, it's been adapted for schools, for healthcare facilities, for specific regions. So that framework of ranking your level of service and tracking progress over time is useful in many settings and potentially could be customized specifically for persons experiencing homelessness, which we'll talk about a little later. So we went ahead and proposed a set of service ladders for measuring access to water and sanitation in California. We have a number of them in the report. I'm just going to focus on accessible water and accessible sanitation. This is your physical ability to gain access to these services, and this is the main barrier for persons without shelter. So for accessible drinking water, we said we defined a goal of accessible water, that it should be available in the home in sufficient volumes to meet domestic needs at hot and cold temperatures 24 hours a day. So there's a number of sort of considerations in there that we're thinking about. That's location, the time to collect that water, is it in sufficient volume, the temperatures, and the available hours. And the main reason why we're talking about temperature is two reasons. One is that the California Plumbing Code requires hot and cold water in the home, and because the main source of data on this, the American Community Survey, only tells you whether a household has hot and cold water or no water. So if we wanted to use a big public data set, we couldn't, for example, just look at households with cold water. It wasn't an option. So we went ahead and developed a service ladder from satisfactory to moderate to marginal to unacceptable levels of service for drinking water. And I'm going to focus in on these moderate and marginal levels as most relevant to persons experiencing homelessness. The drinking water here, we are interested, of course, in access to drinking water for homeless, both as, that they can drink it, but also as a place for them to be able to wash their hands. Having water to wash their hands is an essential part of hygiene as well. So focusing in on the moderate level, we define that as having sufficient hot and cold water from an improved source on the premises, either indoors or outside, and reliably available 24 hours a day. Bottled or delivered water would be acceptable in some circumstances. And we define sufficient as being 43 gallons per capita per day. So what we're describing here is a living situation in which water is not necessarily in your unit, not necessarily in your apartment or in your house, but it's broadly on the premises. So you could envision that this might be applicable to a homeless encampment having a restroom and a hand washing station within that encampment. So it's easily available to you. It's proximate, even if it's not exactly in your living unit. 43 gallons per capita per day. I won't belabor it, but we pulled that from studies that have been done on residential end uses of water in California as a minimum amount to meet your basic indoor needs if you cut out the amount people typically use for leaks. That's why 43 is a little lower than what people often talk about. And then marginal would be sufficient water from an improved source, including bottled water or tanks of water delivered by truck, provided the collection time is not more than 30 minutes round trip, including waiting time, and reliably available at least 12 hours a day. So this is something that might be applicable in emergency living situations. You wouldn't necessarily want somebody living long-term in a situation where they have to go 30 minutes to get their water and they can only get it 12 hours a day. But this is the type of situation that would be adequate to sustain life after, if you have a short-term emergency. And quite frankly, this would actually probably represent an improvement in access to water for many people who are currently unsheltered. The 30 minutes a day is pulled from United Nations Development Program. That's their standard for providing water in refugee encampments. And we'll be looking at that again in access to sanitation. On accessible sanitation, the goal we presented there was that toilets should be private, located in the home, safe to visit, and available when needed. So as you saw, both with water and sanitation, the goal is that, of course, people should have a home and a place to access water and sanitation in the home. But if you don't have shelter, we also do address that in sort of our marginal and moderate access levels. The considerations there are that toilets should be private to use, meaning you should be able to close a door. You should be able to get at them without compromising your physical safety, which is a big concern with public restrooms, especially at night. They should be well maintained. They should flush. They should be clean. There shouldn't be an excessive number of people sharing a toilet, and the location should be reasonably proximate to where you live, and it needs to be open 24 hours a day. So again, we present a full service ladder from a level of service you'd expect to see in a typical California home, but then running down through moderate and marginal, and I'll focus on moderate and marginal because they're applicable in sort of group living or short-term outdoor residences. So in moderate, what we present here is the idea that a toilet should be private, secure, well-maintained, on-site, but possibly shared with other households and available 24 hours a day. So the type of context you're talking about here is perhaps some kind of group living situation where you have a shared restroom. This might be, for example, you have a group living in emergency shelters, or you're in a single room occupancy. These are essentially multi-unit buildings that are small apartments, but often instead of having their own kitchen and bathroom, they have a single kitchen and bathroom per floor. So they share it. You could also picture that this might be applicable, again, to a homeless encampment with a single shared restroom. The maximum number of people, we define that as being 10 male residents per toilet and 8 female residents per toilet. So that is pulled from the California Plumbing Code for residential dormitories as sort of a reasonable upper limit on how many people can share a toilet before it becomes unusable, we'll say politely. And then marginal is addresses what you might see in certain shared living situations, such as encampments, boat marinas, RV parks that don't have their own in-unit toilet or it's not hooked up, and they have to access some kind of shared facilities. So we define this as private, secure, well-maintained facility, possibly shared with other households, no more than 50 meters from the home and available 24 hours a day. So that 50 meters distance is again specified by the United Nations High Commission on Refugees. So it's considered a reasonable standard for a short-term living situation. So moving on to who lacks access to water and sanitation in California. So in our Plumbing the Depths report, we took a look at the number of people who lack access to water and sanitation, and we looked at a number of different groups for this study. First, we took a look at individuals with a residence. That's down there in the blue square. So this number is derived from American Community Survey data from the US Census Bureau. They do an annual survey where they ask 5% of US households a number of questions, and one of them is, do you have an indoor flush toilet? Do you have indoor hot and cold piped water? And do you have a shower and bath? And so we took a look at that data and added up the number that did not have an indoor flush toilet and did not have hot and cold water in California. So for no toilet, you're in a home, you have an address, you have a roof over your head, but you do not have an indoor flush toilet, at least not in your unit, is 88,000 persons. And then no hot and cold piped water was 91,000 people. And then we also added on top of that the unsheltered homeless, that's the green bucket. We simply assumed that if you are, so unsheltered homeless is essentially the people who are living on the street or in some kind of non-traditional housing day round. So they might be in a tent, they might be sleeping on a sidewalk, they might be under a highway overpass. They're not going to a formal shelter at night. We assume that most of these people have limited or no good access to water and sanitation and added them up, 68,000. And then the last group that we looked at was sheltered homeless. So these are people that probably go someplace at night to sleep, but the problem is that many emergency shelters close during the day. So people might have access to a toilet at night, but for a good 12, 14 hours during the day, they're reliant fully on public services, which are often inadequate. So that's another 52,000. So you get up to about 210,000 people for each group that lack consistent access to a toilet or hot and cold water, either because they do not have their own house or because their house has inadequate plumbing. So there are many people in the state who rely on public toilets. In fact, public toilets just broadly are public service that many people rely on regardless of whether or not they have a house that they sleep in at night. Public restrooms present a lot of problems. They are often shared among far too many people and to maintain them properly. They're often too far from, if a person is, for example, living in an encampment and they have to go, for example, a mile to use a restroom, that's often not feasible, particularly if that person has any sort of disability. Or at night, that can be a serious compromise to your personal safety to have to go that far to reach a toilet. They're often closed at night. For example, San Francisco and LA often tout that they have these public toilets, but all of them close during the night, or most of them, I should say, close all night long. They can be dangerous to visit if they are in a location that's not safe, especially for women and children. It can compromise your personal safety just to gain access to that restroom. They're often poorly maintained. They're often not properly cleaned. They often lack simple doors or locks or soap or toilet paper. They're simply often unusable. They may exist. There's too few of them in the first place, and then even when they do exist, they're often unusable. And I won't delve into all the sort of information on this, but just refer you to Measuring Progress and Plumbing the Depths, where we pull together a lot of newspaper reports and city council notes, and also a great report from someone who I think is going to be here today from the Los Angeles Providers Collective, talking about these problems with public toilets in California. And I just want to point out that a lack of public toilets is a problem for everybody. You know, we're here to talk today about access to sanitation and hand washing for persons experiencing homelessness, but public toilets are a vital resource for living in a vibrant and clean city. Those who lack shelter simply are particularly dependent on having those facilities. So they're just one group of people that relies on this resource, but we need to be thinking about this as part of a healthy and vibrant city for everybody. Last, I'll wrap up with some policy recommendations. I have a number of them. So one important piece is that we argue that California should recognize sanitation as a co-equal component of the human right to water. I think there's a bit of ambiguity there. The language specifically says that every person has a right to water for sanitary purposes. I think, you know, as I presented to you earlier, and with a wealth of information from public health data, it's very clear that sanitation and clean drinking water are completely interlinked. You don't get the full benefits of clean drinking water unless you also have access to sanitation. So we need to think about these as co-equal components to achieving a goal of public health. We also recommend that the state needs to think about recognizing and addressing barriers to water and sanitation failures at the household and individual level. We've been thinking for a long time within this centralized wastewater and centralized drinking water framework, but some of the barriers to access happen at the household and individual level, including for persons experiencing homelessness. We recommend using the service ladder approach to define and track safe, affordable, accessible water and sanitation, both for those with permanent shelter, and we think there would be room to develop a custom set of ladders specifically tailored to the needs of persons experiencing homelessness. And we recommend identifying minimum standards for access to drinking water and sanitation for those without shelter. So how many toilets for how many people? How far can you reasonably go to access them? How many hours a day do they need to be open? Some certain basic standards like that should be in place. We also recommend that we should be using water quality objectives and stormwater permits as an avenue to direct resources towards sanitation and hygiene. And this is going back to that slide I showed you earlier, pointing out that there is a clear link between access to sanitation and good quality sanitation and local surface water quality. So this is an avenue for us to start thinking about. We have these two goals, both to achieve clean surface water and to achieve the human right to water and sanitation. Are they linked? Can we be achieving co-benefits through a targeted set of interventions? Last, these mobile hygiene units in public restrooms have been rolled out in a number of California cities. I think you're going to hear more about them later today. And they have been highly effective. They can be often better maintained, and they're carefully staffed, which is also our last recommendation, which is that staffing public restrooms with members of the community that they serve is often transformative and has been identified in some studies as the biggest factor in determining whether a public restroom is safe and clean and well maintained. And with that, I will just say thank you. I think I'm on a panel later where I'm going to be taking questions, so I won't take any now, and I will turn it over to the next speaker. Thank you very much for your time.
Thank you, Laura. So I'm going to introduce our next speaker, who's Dr. Wilma J. Wooten. Dr. Wooten is the Public Health Officer for the County of San Diego. She has both a medical degree and a public health master's degree from the University of North Carolina, Chapel Hill. She completed residency at Georgetown Providence Hospital Family Practice in Washington, D.C., serves as adjunct professor at University of California, San Diego. She's been with the county since 2001 and has served as the public health officer since 2007. She is an ardent supporter of public health with a strong interest in disparities and social justice and equity. Please welcome Dr. Wooten.
I'll need adjustments here. Good morning, everyone. So Dr. Feinstein has talked about the what. I'm going to talk about the why, and I think later then we'll talk about how. Looking at some policies, potentially suggestions for policies, practices, and programs that can be moved forward. So, actually, this is not and I went through it beforehand. So, let me go back. This one. There we go. How frightening is it to see a slide deck? Okay, yes. So today I am going to talk to you about basically why should we be talking about, why should we be having this discussion? Why is it important to be talking about sanitation, particularly in the homeless population? So homelessness is closely linked and connected to declines in physical as well as mental health. And homeless persons experience high rates of health problems, HIV infections, drug and alcohol, mental health issues, as well as other infectious diseases, tuberculosis, and you're going to see some other examples that I'm going to share with you. But the root cause could be determined as poverty, but that could come from various angles. Someone could lose their job because they are an illicit drug user, or because they have mental health issues, or because they might have domestic violence issues for women. So there are many ways and avenues that people end up being homeless. This slide I thought was very unique because when you want to identify what jurisdiction has the worst homelessness crises, it depends on how you ask the question and how you measure homelessness. Now, in the top two maps, those are related to rates. The bottom two on the bottom left is percentage, and the bottom right is numbers. And we're going to focus on the numbers. I think many jurisdictions do point-in-time counts. We just did ours in San Diego in January. So that's the data in those reports is focused on the numbers. And for 2018, these are the top 5 jurisdictions that had the most people experiencing homelessness. For 2018, San Jose got on the list. What's going on in San Jose? The year before it was Washington. In 2017, it was Washington, D.C. This is just some stats in terms of, from 2017, the total number of, and as we all know, these are estimated numbers and are probably largely underestimated, but these are the data that we have. 34 in every 10,000 individuals in California are experiencing homelessness, and 31% there was discussion about unsheltered versus sheltered homelessness. This map is from 2018, and you can basically see most of the dark blue is on the West Coast. So California has 12% of the nation's population, but we have 24% of US homeless population. That's a stat to take away. Homeless individuals, so why is public health and homelessness connected? Why do we care about homelessness? Homeless individuals are at greater risk for many diseases because, number one, of their limited access to sanitation and hygiene, because barriers to health care. An example, during the hepatitis A outbreak, if you can't just tell someone to go to the nearest clinic, because they have to take everything that they own with them. And then where are they going to leave those belongings when they go inside? Because most likely they can't take it in with them. So we have to meet them where they are. So that's a major barrier to healthcare. And then there are increased exposures of infectious diseases and the inability to self-isolate if it's a health condition where they may not be sick enough to be in the hospital. They can be discharged, but they might still be infectious. So we had that situation in San Diego for our hepatitis, some of our hepatitis A clients, and develop an infectious housing program. That same thing exists for tuberculosis as well. Also, homeless individuals are impacted by environmental related factors. Climate change is having an impact on this population as well. Extreme heat or extreme cold, depending upon the part of the country that they live. And also disasters. So for the extreme temperatures, we need to be included that in our climate change planning. And then for disasters, particularly fires, we should be including how we're going to address the homeless population in our disaster planning as well. The homeless population has limited access to optimal nutrition and physical activity, and their health needs, particularly for homeless children, may not be addressed. They might be missing the vaccine-preventable diseases that are recommended for their age. And lastly, there are some specific population challenges: lack of transportation. Communication with this population is difficult. We found during the hepatitis A outbreak that when people were seen in the emergency room, we had to send out communications to our providers so that if they had someone that they thought had hepatitis A, to call our epidemiology program so our staff could talk to that person while they were in the hospital. Because if they were discharged, we may not be able to contact them. And that certainly did happen early on. And then lastly, low vaccination rates among adults for CDC-indicated vaccinations. And I am very proud to say that as a result of the hepatitis A outbreak, we convinced CDC and the Advisory Committee on Immunization Practices to include homelessness as an indication for hepatitis A. Now, we've been talking about what we feel homeless individuals should have, and they deserve everything that everyone in this room has in terms of basic needs. And I think most everyone is familiar with Maslow's hierarchy of needs. And at the very base and bottom there are the physiological needs: air, water, food, clothing. Those are basic needs. Getting appropriate sleep, that's a basic need. Safety needs, security and safety also. These are basic needs that contribute to one's survival. So if you look at those basic physiological needs, they are related to other health conditions. Disease burdens, people might have other chronic diseases, whether we talked about before, they might be more prone to tuberculosis or HIV or mental health issues. Where are they going to get the care for those issues? They may have increased physical pain. So a lack of basic needs contributes to the management of the chronic diseases that these people might experience, that the homeless population might experience, as well as dental care. Having water is very important to brush your teeth. So very important. So the next couple of slides, I'm going to share with you just some examples of outbreaks that have occurred San Diego, in California, and in other jurisdictions. And this particular slide talks about murine typhus, which is an infection from a flea, basically that are on rats. But it's due to trash, garbage, conditions that set up prime opportunities for rodents to be present, and they carry disease. That's usually with the urban form of the disease, but in the suburban forms, it's your cats that are going out into the woods. But feral cats and opossums are the culprits for spreading this particular disease. Then we have in San Diego, we had several cases last spring of wound botulism. Again, this was homelessness and illicit drug use sometimes goes hand in hand. So this was some of these cases were related to illicit drug users, obviously, and some were homeless. These outbreaks, or several outbreaks that have occurred in Seattle, Washington. Group A streptococcal infections, Shigella, or we call it shigellosis. These are gastrointestinal infections. You heard about that from our Dr. Feinstein. And then Bartonella quintana, which is trench fever due to body louse. So again, louse and the fleas, when they bite you, they also defecate, and the bacteria that they carry causing these infections are in the feces. So if someone is infected, they have close contact with someone else, they can spread the disease that way. So in San Diego, the last example I'll share with you is our hepatitis A outbreak. In all, we had 592 cases, outbreak cases. 70% of our cases were hospitalized, and we had 20 deaths, which is about the case fatality that has been determined by CDC between 3 and 4% for adults, not children, but for adults. This is the epidemiology curve that shows when the outbreak was determined early on in March, and we were able to trace cases back to late November. We declared a local health emergency on the 1st of September. The state also declared an emergency. And then we ended the emergency because we saw our numbers go down due to the collaborative or collective impact of government working with community partners and other governments, our city governments, to help address this issue. And then thankfully, we were able to call the outbreak over after 100 days, which is 2 incubation periods, on October 19th last year. Now, what I want you to share, and this is probably one of the money slides, if you will, you see California, 709 cases, and 592 of those were from San Diego. But if you go over to the east side of the map, you'll see that in Kentucky, 4,476 cases. West Virginia, 2,469 cases. Ohio, over 2,000 cases. Their outbreak is still going on. And we've consulted with most, if not all, of these jurisdictions, sharing our best practices that were implemented, because there had never been anything seen like this in the US, at least in post-vaccination era. So we shared all of our best practices and continue to share information with them. Now, the primary focus for my presentation is about sanitation, but I just want to with this one slide, talk about vaccination. So We have vaccinated actually over 212,000 individuals. This includes both first time and second time, the second dose vaccination, but most of them are first dose vaccinations. So we vaccinated people. We have the public health centers there. We would take people there, but we had to go to where they were, and that's what's below the line. All of those field events, we call them foot teams, where we would pair up nurses with our homeless outreach teams, which may include law enforcement or Parks and Rec staff and social workers, and went into the riverbeds where people were, because they were not going to go to a public health center. We also placed nurses at the jail intake so that we could vaccinate inmates as they come in. Many of them were illicit drug users. Some of them were homeless. We also worked with our behavioral health services providers to vaccinate individuals that were going to our substance use disorder treatment programs. In the emergency departments, I talked about that. So we explored every possible opportunity to get vaccinations to our homeless population who were at risk. So homeless and illicit drug users were the target populations for the hepatitis A. For all of the infections that I've shared with you, they could be spread by any of these. So in touching objects or eating food that an infected person has handled. And it goes down to not washing your hands. So you need to have water to wash your hands. Close person-to-person contact with an infected person. For hepatitis A, that is the most common cause of how hepatitis A is spread, not through eating contaminated food, which is what we mostly hear about. And also the use of recreational drugs, whether injected or not. When we were trying to decide on the target population for the hepatitis A outbreak, we knew that we roughly had about 30,000 homeless individuals. Many of those might be illicit drug users. SAMHSA has estimated data that there are over 420,000 individuals in San Diego that are drug users, but that included marijuana. So we wanted to focus on the highest of the high risk, those individuals that were meth users, IV drug users, or both meth and IV. And that ended up being about 125,000 individuals. So we have surpassed that total. Also, through sexual contact, that's close contact. So sharing of personal body fluids. These are the approaches. No matter what the disease is, either treatment if it's a disease that can be treated with an antibiotic, or vaccination if it's a vaccine preventable disease. Sanitation, washing your hands, cannot be stressed enough. And then education. The education with hepatitis A took just as long if someone got the vaccine initially as it did for someone who refused. We spent about 30 minutes with individuals trying to educate them. And eventually, because initially people were very suspect of government, did not trust us, and thought this was a conspiracy. But going out with law enforcement and our homeless outreach teams helped to provide credibility for our nurses, and the populations ultimately came around. We utilized these hygiene kits initially to incentivize people to get the vaccination, and we still have them available if, and nonprofit organizations in many cases contact us to get these. These are free, there's no charge for them. One of the features, this has never been used by public health services. It's used when you have concerts, you have the porta potties and the hand washing stations, but we had never used this strategy to respond to a public health issue. So we piloted hand washing stations in July, and then when we declared the emergency, we disseminated them, and that's through the county health department. We placed them in collaboration with the 18 municipalities in locations where homeless individuals were located. Our Department of Environmental Health developed two important documents, a disinfections guideline, and then also a sanitation procedure for public right-of-ways. The disinfection guideline was initially created to assist the restaurants with their infection guidance, but we ultimately expanded this to give to any businesses that had a public restroom. And then the outdoor sanitation efforts were again the public right-of-ways, and we borrowed from Los Angeles Department of Public Works. They not only clean, but they also sanitize their streets, and we found out about that, and we reached out to them so that we could replicate that in San Diego and provided these guidelines to the city of San Diego because they had the largest number of homeless individuals. But we also provided these guidelines to the other 17 municipalities and our unincorporated areas, which is composed of about 36, 37 towns. So this is just a picture of contractor cleaning the streets in San Diego. So we feel that the impact, not only to the homeless individual, but to our environment and our communities, fall in these three buckets. We want to focus on the health of the homeless individuals, but also if they become infected, some infections could expand into the general population. We were able to prevent that with the hepatitis A outbreak. We developed a special campaign to help prevent the spread to the men having sex with men population, and we were very successful with that. In other jurisdictions were experiencing the outbreak, they did have an extension of the hepatitis A infection into the MSM population. With environment, and this is, we went through this thought process because we are aware of the safe parking programs, and there's some legislation coming down the pike to provide guidance on that. So the three buckets that were of greatest impact that we've identified, and this is still a work in progress, is the health of the homeless individual as well as the general public, the environment, making sure that the environment is safe. And when people park, they have batteries. We talked about the RVs. Where are they going to dispose of the hazardous material? Or they might want to change the oil in their car. Where are they going to put that? So having information and guidelines for them on how to work through those normal daily activities of daily living that we do and don't even think anything about it. And then in terms of the environment, also fires. Many times individuals that might be in the camps, it is a risk for fires starting because they are burning fires at night. And then on the community side, we want to ensure that the communities continue to thrive by supporting business-friendly environments and keeping our communities safe and clean. So the end goal is to improve the ability for homeless individuals to maintain hygiene, and I think that is perfectly clear with the presentations that you've heard this morning. Just want to share with you here in my wrapping up, during the hepatitis A outbreak, we actually surveyed all of the municipalities to find out where they had public restrooms and if they had hand washing stations themselves. The county stopped disseminating hand washing stations at the end of February. So this information was placed on our 211 website. We are going to be issuing a survey again in a couple of weeks to find out where public restrooms are, if they are still in locations that were previously identified. But we want to make this information available and put it on 211's website. So in ending here, government cannot do any of this alone. We really need the partnerships. And that really is what Public Health 2.0 is about. It is about creating unique partnerships to address the needs of the community, no matter who those community target individuals are. This is just a list of the various partners that were utilized and engaged during the hepatitis A outbreak. In the last 3 slides, I want to share with, did you want me to go back to that? Okay. We want to share with you some best practices. There are bridge shelters that were stood up by Alpha Project. They have a shelter for 350 individuals. Father Joe's has a shelter with the capacity of 150 families. And then there's the Veterans Village of San Diego. They have porta potties, hand washing stations. They have places for people to wash their clothes. This is not a permanent situation, however. This is a bridge. The goal is to get these individuals into permanent housing. Another best practice, Jewish Family Services has a safe parking program. They have a couple now. So we want to work with them, and the legislation, if it goes through, would address standards. But we've been thinking about, if this does go through, what we require and want the information, what information we want to get from municipalities that support this. And then lastly, I want to share with you an award that Public Health received after applying in April of 2018. We were awarded by the Kresge Foundation, the Emerging Public Health Leaders Initiative. And one of the 3 goals was to develop just better collaboration, coordination, and communication with our municipalities. And one of the outcomes was to develop an MOA to have clear roles and responsibilities. And we have, this is actually also a recommendation from the state hepatitis A audit. We completed that, and we will be using this as a template to work with all of the other municipalities as well as our unincorporated areas in San Diego. And that's just a copy of that. But all of this work is through collective impact. And through collective impact with collaborative actions, we can have collective responsibility to work on those issues for the needs of our community. And I hope that at the end of today and going forward, we identify policies, best practices, and programs to address sanitation efforts for persons who are homeless. Thank you.
Thank you, Dr. Wooten. So now we're going to take a 5-minute break, and then we'll be back for our first panel.
Press this on it.
folks wouldn't mind starting to take their seats, we want to start promptly. Thank you. Great, thanks. Good morning. My name is Yana Garcia. I'm the Assistant Secretary for Environmental Justice and Tribal Affairs here at the agency. I really want to thank, first, before anything else, just the Water Board staff for putting this together and for having me here today to moderate such an awesome panel. You'll hear from some really great folks momentarily. Just very quickly, as the Assistant Secretary for Environmental Justice and Tribal Affairs here, it is my great honor to work on issues around equity and access, social and racial justice, and many of the issues affecting our tribal communities statewide. So I come to this set of issues from that perspective and just feel very honored to be here today. I'm going to start with some quick introductions for our panelists, and then I'm going to kick it over to them to share with us a little bit about their work before we go into a couple questions that will either go to each of them individually or to all. I think we're not going to do questions from the audience now. We'll do comments at the end. So I'll start with Tara Rubin. Oh, sorry, Talia. Sorry about that. With Talia Rubin. Talia is a project manager at the City of Oakland. She currently oversees a variety of homeless service programs serving unsheltered Oakland residents and has an extensive work history in the field of social work. She's worked throughout the Bay Area and Southern California. Ms. Rubin has a bachelor's degree from UCLA in cultural anthropology and a master's in social work from Cal State University, LA. She's worked for the city for nearly 4 years and focuses specifically on issues impacting the lives of individuals and families experiencing homelessness throughout the city. Welcome, Talia. Keith joins us here from Los Angeles, where he serves as Assistant Deputy Director for the LA County Department of Public Works. Mr. Lilly has over 25 years experience in water resources engineering. Excuse me. In his current role, he manages the county's safety program and develops infrastructure enhancement efforts to increase stormwater capture for both water supply and to reduce flood risk to downstream communities. Mr. Lilly also oversees integrated resources planning for the county's flood control district. He specifically focuses on master planning for public use of open space and the development of safe, active transportation routes for walking and biking, rest and shade structures, and safe drinking water and bathroom services. Mr. Lilly received his BS in civil engineering from Louisiana State University and a certificate in engineering management for construction from the University of California at Los Angeles. Welcome, Mr. Lilly. Last but certainly not least, Chris Kepler is joining us today from San Francisco, where she leads statewide strategy, programming, and impact evaluation for Lava Mae. As a senior director for the organization, Lava Mae is an organization that you've actually already seen featured on some of the slides. Lava Mae is a San Francisco-based nonprofit that brings mobile hygiene and other services to people experiencing homelessness in San Francisco, Oakland, and Los Angeles. Welcome, Chris. Now, why don't we start with you, Talia, sharing a little bit about the work that you're doing at City of Oakland?
If you can't hear me, let me know. All right. I'm going to start with just a little overview about what homelessness looks like in Oakland specifically. So this slide will give you some of those highlights, and I think the slides will be shared so you can get some of that information. I'm not going to delve too deep. The main point I want to make is that in our last homeless count in 2017, which is 2 years old now, we'll have new numbers coming out this summer. Oakland held about 50% of the county-wide homeless population, and so Oakland has a unique positioning within a larger municipality. And so we do some of our own work, both in partnership and then sometimes sort of not. We do our own thing in Oakland, and we're able to do that leveraging our own dollars, our own policies, council, and all that kind of stuff. So just want to give that some context. The profile for an Oaklander who is unsheltered is right here. Definitely intergenerational trauma, African American, older, male, single. This is our profile. I want to talk about the challenges, and this is really important to note. Our point in time counts are recording a single point in time, a single night, whereas we're serving way more people during the year. So it's important to note that picked count number is sometimes thrown around, I think it's important to actually think about who we're serving and how many folks we're actually serving. So in Oakland, we have about 1,700 people who are actually coming into our homeless systems during the year. That's in addition to about 1,700 who are always there, meaning we're not able to move them out quickly enough. And we're only exiting 738 people a year. So that tells you where that disparity is and how people are staying homeless for longer periods of time. So that's to give you context. The community impact in Oakland specifically, and I don't know if any of you have been to Oakland, is encampments, and we see more and more encampments, larger encampments. The city actually doesn't have a specific definition for encampment. You know, cities like Portland did something like 6 or more, or, you know, different municipalities do that. We just have not settled on one, and we kind of want to walk away from that. An encampment is of one or many, the same thing we do with our HMIS system, right? A household of one or many, so we basically use the same measure. And that's really important. We do track our encampments, our outreach teams in different ways through public works, service requests, and all that kind of stuff. So we do have, for the last quarter, we tracked, let me see, it was 36 encampments of 6 or more persons, and our outreach team in the last quarter visited 92 distinct places where people were living in places not meant for human habitation. So that can be RV encampments, as we call them, structures, tents, doorways, all that kind of stuff. We just put that into one large category. The last slide was really talking about the different interventions, and we're going to focus on the second one there, obviously, right, is the encampment management, unsheltered homelessness, and then lead into the hygiene, sanitation, and safety interventions that we have. So the first piece is the encampment management team. In the summer, I've been working for the city for about 4 years, and that's when I started convening different departments really informally. It wasn't until June 2017 that we formalized an encampment policy that was an assessment to look at different risk factors in encampments, whether it's in the right-of-way, the size. You'll see in the last bullet point, those were the 4 factors that we looked at. What was really important about the EMT team is that we moved away from a complaint-driven system where our public works departments were getting complaints that, you know, the more complaints, the more service this particular site would get. And we just moved away from that. We looked at, is it impeding the walkway? Is it next to a Head Start center and kids can't get in? Is there a lot of syringes there next to the Head Start center that's blocking the sidewalk so kids have to walk in the street through needles to get to their Head Start program, right? Like, we were looking at all of these different features and looking at risk factors and really trying to be equitable in how we service encampments and what that looked like. What is service to an encampment? We can't continuously close encampments or relocate folks. So what were the interventions we developed were clean and clears, closures, and debris pickups. The city developed 3 distinct postings to keep us aligned with the laws about moving folks or relocating folks. We post with different color postings, so it's clear to people. If people aren't literate, they can see a pink posting as closure versus a green one is a debris pickup. So we were able to really create some uniformity, and so people really understood the process. What I'll talk about next is our health and hygiene specifically, and this has been I've worked on this. I'm called the porta potty queen at work, which is kind of weird, but that's where it's come to. This is actually pictures of one of our largest encampments at 35th and Peralta. You know, you'll see the bullet points. These are the things that we started implementing at encampments, right, for health and safety, to equalize health and safety to the housed and the unhoused in that community. And that's how we got a lot of community buy-in from what we were doing, was to not package it or sell it, but to be realistic about, we can't move people, we don't have enough housing for folks, so let's make this a positive coexistence and reduce the harm for everyone. So you'll see there's K-rails there. Those are the cement barriers there. This is actually an encampment where we closed this one little street called Magnolia, and people are encamped there rather than being on the sidewalk, so the walkways are open for folks. There's porta potties, there's garbage pickup. So to drill down a little bit, what we've done, this was presented earlier about debris piles, right, and rats and the sanitation around from that perspective. What we've done is a regular garbage pickup at our encampments. We have 17 sites that we serve weekly through our public works department directly. We don't have to post anymore. There's agreements about where homeless folks are going to put their debris piles. Even if they're not, they can bring them out into the street. We have the same homeless crew, the same homeless supervisors, and an OPD team that goes out. And so there's relationship building, intervention opportunities. It's really been a fabulous partnership. We just hired, I used to roll out with them, but we hired an outreach coordinator now, so I have somebody that can do that also. And again, these are all opportunities for engagement and really meeting people where they're at. That's the principle behind it. The opposite end of it, of course, is sanitation and health. I don't know about where you all live, but Oakland has an extreme illegal dumping problem. It's pervasive. Even before encampments were there, and now they happen alongside encampments on a regular basis. So some of the debris piles have nothing to do with our unsheltered population, but we're gonna serve them as well. It's part of what we do. The next thing, so you'll see in these pictures, there's sort of like the before and afters of these piles, and and you'll see a porta potty next to one of those piles too. Next is porta potties. So we started doing curbside porta potties March of 2017. We've served 27 sites total, I think. Currently, we have them at 18, but not curbside. You'll see it's 14 curbside. We also have 3 community cabin sites operating and 1 safe parking site. Curbside porta potties are extremely challenging. Maintaining them, getting site leadership to keep them clean, to keep other debris out of the tanks, right? Because United Site Services is not a house cleaner, as I like to say. They are a mobile plumber, so they come and take things, but if there's syringes, clothes, garbage, whatever else in there, they're not gonna service them. We have developed a site leadership program. We stipend, we bring cleaning supplies. Some sites we haven't had to go back to since the day we dropped the porta potties. Some sites we've had to remove and replace units upwards of 12 times, and we'll continue to do it. There's no punishment for not maintaining a unit. We will just keep removing and replacing it. We're not punitive. It's really important that for me, from like the clinical social worker hat that I wear, is that we're not punitive. We just keep raising the engagement to the best of our ability. Definitely bringing stipends and cleaning supplies has helped a lot. It's like a janitorial leadership, and it can rotate from people at a site, or you just sort of assign it to one person who keeps it up. The challenges have definitely been the consistency with United Site Services. I've done trainings with their techs, so they're not intimidated by or discriminatory against unsheltered people where their units are at. That's been a long, sometimes frustrating relationship. The city of Oakland has a citywide contract with United Site Services, so I'm mandated to use them as the provider. That doesn't mean we won't look at other partnerships that might work more, but I really am happy about where it's moved in the last 2 years. We've been able to definitely, I've literally ridden along with United drivers and trained and introduced, and some of the drivers themselves are able to do that, so it's kind of meeting them where they're at, same as we do our clients. All right, the next thing, so these are pictures of different curbside encampments. You'll see, like the one on the top right over there is, you see there's a little picnic bench there, a tent right behind it. That's where folks eat. The porta potties are right next door. There's a wash station between the ADA and the standard unit. And then you'll see other sites, the one, I guess I put them right across from each other. Not a very clean site. There's all this debris. It's kind of it's a challenging site that we have. So they won't look the same, and we just keep working on it. Let's see. Oh, I think. So one of the things that we've done in our health, hygiene, showers, garbage pickup, any of that stuff, is we go out and do resident meetings at encampments before we bring porta potties, and we're really clear about what the city's role is and what resident roles are. We try to be as communicative about that. We've put out flyers, we've brought syringe boxes, we have other outreach partners that go and support us in this work and spread the word, but we will really start with a meeting of city folks and the residents of that particular encampment to exchange that information to ensure the buy-in. Now, this is a moving population, so you're gonna have new people move in. That's not a one-time deal. You're gonna have to go back and have those meetings again and train up and teach folks. So just to put that out there. Also, showers is one of our awesome partnerships with Lava May, and Chris will talk more about this. So I just want to make sure, though, to mention it, it's been a really great partnership. We have Lava May at our 3 community cabin sites, 1 street-based site, or curbside site. A great partnership. We do pop-up care villages with Lava May. We do the showers. We really helped each other navigate the system. Lava May was our first permitted shower program in Oakland, so we learned how to get the East Bay mud permits, how to get the fire permits, all this kind of stuff together. And we've also been able to secure waiver of parking fees, so that's been really great. I have many no parking signs in my cubicle. It's many. So that's our health and hygiene and safety interventions. I was asked to mention a little bit about our community cabin sites, so I'm just gonna hit a few of that for you. The community cabin sites started December 2017. We've opened 4 sites total. We have 3 operating currently, and we have 3 more slated to open in the next few months. Excuse me. What's our goal? Low barrier. People come as they are. The 3 Ps, as we say: partners, pets, possessions. We do have a code of conduct. We do have a program agreement. And we are a geographic intervention. So if we're talking about sanitation, reducing piles of debris, things like that, we have so far addressed our 4 largest encampments in the city of Oakland. And I think the terminology is resolved the encampment. I don't think we've, I know we haven't resolved everybody's unsheltered status, but I guess we've resolved that encampment is one way of putting it. We have showers at the cabins. They're modular units, modified tough shed brands with double pane windows. There's 3 windows a unit, real lock doors with bolt locks like your apartment doors, insulated. They have lighting, and they have USB ports, like 12-volt USB ports. It's not full electricity. They're not heated. There isn't a full kitchen, and there isn't a flush toilet. It's porta potties and wash stations. So just to be clear about that, they are not intended to be permanent. They're not intended to be anything but bridge housing, I guess is one way of putting it, but a different sort of model of that. There's 2 persons per unit also. We serve up to 40 people at one site, so we'll have 20 residential units and then 2 more units, 1 for a site manager and 1 for a dedicated case manager. These are some pictures of our team. The picture at the bottom right is also a Narcan training for our team. So I also want to add that in terms of health, safety, and sanitation is about syringe exchange, syringe use, safe use. We try to feather that into all of our work to be holistic about it. Yeah, so far those were our exits. And I think that's it. Okay.
Thank you.
Yeah.
And thanks for bearing with me on a Friday. I'm just going to mention, I failed to mention this before, but the goals of this particular session are really to obviously show the challenges that are taking place on the ground in various locations, focusing on Oakland and Los Angeles, the way that local governments are responding to that, and just really emphasizing the importance of partnerships with non-governmental organizations. So with that, I'll kick it over to Keith. Thanks.
It's even better. Okay, turn it on. All right, so I oversee integrated water resource planning for stormwater infrastructure throughout Los Angeles County. I have look at this one all day. All right, so Los Angeles County, as you're probably all aware, has about 10 million people, 27,000 square miles, 88 cities. I'm not here to talk about the homeless issues throughout the county, but rather along the waterways. Of the 50,000, approximately 50,000 homeless counted in Los Angeles last year, many of those are along our waterways. They reside in them or adjacent to them. Public Works oversees the Los Angeles County Flood Control District, which is a separate legal body, but it's basically the county stormwater management and stormwater capture for local water supply. It was formed in 1915 after a number of very large floods in the region, a need to control that water, so we built all the major dams throughout the county, channels. We have about 500 miles of open channels that were designed to rush that stormwater as fast as it can to the ocean, and also a network of drains and catch basins throughout the county. So one of the concerns with our waterways is a number of encampments are formed from homeless that live there. The opportunities there because of the overpasses or bridges that go over our waterways, and also they're very isolated. Some areas aren't otherwise open to the public. Some areas are heavily vegetated, so there's areas there. And then also along these larger channels, there may be large storm drains that connect to them with gates, and they can actually live inside these channels on that enter them. Because of that, they are certainly unsafe during storms. They discourage other recreation activities. A lot of our areas are open to the public. We have greenways, bikeways, this type of infrastructure. Some of those activities where they may be in these side channels. There's all their possessions, bicycles, things that they bring in there can block the functioning of the storm drains. And then clearly there's the health risks to those living in encampments, those visiting the areas, our workers, and concerns about water quality because of trash and bacteria concerns. So our practice has been that we try and discourage encampments, and then also we actively remove them as they become problematic. In our broader view of the county has a number of resources available to address homelessness. In 1993, the Los Angeles Homeless Services Authority was formed jointly with the City of Los Angeles to lead and coordinate housing and services for those experiencing homelessness throughout the county. The County Homelessness Initiative was created in 2015 to combat homeless crises by developing regional strategies through collaboration with all of the county departments, 30 cities, and over 100 community partners. And then in 2017, voters approved a 0.25% sales tax increase for a 10-year period to generate funding for these services. I noticed I think just last week they started working on the budget for next year, and they expect $400 million from this revenue source to combat homeless issues. So we're able to tap into those resources as we address the encampment removals. So we try and do it with dignity and respect for the individuals experiencing homelessness. We post and provide notices after we've coordinated with our Los Angeles Homeless Services Authority. When they are removed, we'll provide storage for their possessions and opportunities to retrieve them. And if there are storm events coming, we'll try and work with them to accelerate these notices and processes. And I want to mention, we also work with some of the local, it's not just our county agencies, but some of the other local agencies will also help some NGOs. For instance, there's a PATH group called People Assisting the Homeless, and our St. Joseph Center are kind of our prime partners in working with them. I think it's been made clear through the earlier presentation, there was a large hepatitis A outbreak in 2017. As in September, our board identified the outbreak as a local emergency. In November, they directed our department to work with the health services and our CEO that works with the Homeless Service Authority to place hygiene facilities along public right-of-way on our flood control district facilities. We worked with the health services to kind of identify where the concentrations of FA outbreak were, as well as the concentration of encampments and selected sites. This is a photo of those, so they've ranged from three to four of these porta potties, a hand washing station, and a solar-powered lighting. You also noticed we had signage there they're all open to the public, that all were welcome. That was an addition that came along later and really changed how much those were used. Certainly they were well received. The people working with the groups out there understood how much they were appreciated. They had up to 700 uses per week at these facilities. About 4 months into this, after they were installed in January of 2018, the hepatitis A outbreak had ended. The decision was made to go ahead and continue to maintain the facilities, and we've continued to do that. The timeline was through July of 2019 that the funding was continued at this point. Some of the challenges were how costly these are to maintain. If you look at this, it's about $1 million a year. That was actually for the 3 that are on flood control right-of-way. There are 4 from Public Works, 1 was outside the district's right-of-way. The vendor themselves, about less than $100,000 to procure the porta potties and service those. Fire and theft was a somewhat significant portion, about $19,000. Where we really experienced a large cost was in security. There was necessary to have security at these facilities for reasons mentioned earlier by others. We had 24/7 security, so these were open at night. We had lighting there. And then our crews experienced about $300,000 a year for cleanup adjacent to them. So not the actual porta potties and sanitation stations, but the surrounding area where material stuff was dumped. And as you can imagine, as these were available, you had more people aggregating in the area. One of the opportunities with the security is that we actually employed them to keep track of the number of people visiting the sites. This is a example of a weekly report for each of the facilities, what the average usage was, and then some of the issues that occurred. People sleeping in the units, people, for some reason they like to catch these on fire. There are a number of times they were burned. After about 5 months after the outbreak had subsided, and looking at some of the data, we saw that the number of incidents really had declined, or they weren't that serious, or certainly weren't worth the cost of the security. So we reduced that to just 12 hours a day rather than 24 in the evenings. One of the other things that we're doing in our planning efforts is our master planning of our facilities. There's increased interest by communities to use this open space for beneficial purposes. An example of that is our LA River Master Plan. So the 51 miles of the LA River, we have a 40-member steering committee from all walks of life in Los Angeles, water agencies, municipalities, environmental groups, environmental justice groups, NGOs, our group, Public Works, to really look at what we can do to enhance access, what the people want. And interestingly, the top issue that came up for a corridor plan for a flood control district, looking at flood protection, water supply, water quality, recreation, was the housing issue. Equitable housing, concerned that if we make all these improvements, how will that affect the housing prices and affordability? And certainly that's one of the issues that we understand leads to homelessness. Part of our community enhancements along these right-of-ways is to provide open space, areas to rest, to recreate, shelter, shade, access to water, and permanent bathrooms and facilities like that. So we kind of look at that as a potential transition area where ultimately those facilities will be made available, open for everyone, that the unsheltered can use it as well as the community in equal fashion. And that's all I have.
Great. And Chris, why don't you tell us a little bit about the work that you're doing through Lava May?
Hi. So thank you. So I thank you for also showing. I know the trailer was shown up here before in a previous presentation. I just wanted to say this is Lava May. Maybe some of you've heard about us, but we started with buses, muni buses that we converted into 2-unit shower stalls, and over time we felt like using a trailer, we could fit more stalls, as well as you didn't need, I believe it's a Class B driver's license to drive it, and the maintenance was a lot easier. So this is actually a picture of Lava May in Los Angeles. As mentioned, we are in San Francisco. We've been in San Francisco, it'll be 5 years in June. We've been in Los Angeles for 2.5 years, and in Oakland for just over a year. So just to give a little bit of background of who Lava May is, We are a nonprofit that brings mobile hygiene and other critical services to the streets. We only operate on the streets. So everywhere we go is where our houseless guests, we call them. We don't actually use the term, well, we use the experiencing homelessness, but we don't actually call people homeless. That is just a situation. It's just a point in time. So we call them our unhoused neighbors or our houseless neighbors. How Lava Mae got started, I'm not sure if you know the full story, but our founder, Donnie Sandoval, almost 6 years ago, was walking in the streets of San Francisco, and there was a woman on the streets who was crying, saying, if I could just be clean, if I could just be clean. And she had this light bulb moment that said, okay, if we can bring, it was actually in the middle of the food truck craze 5 years ago, and she said, if we can fix creme brulee on a food truck and serve that to people, why can't we bring mobile showers and toilets to the streets? So when she first launched Lava Mae, as I mentioned, we started in San Francisco. She went home and did some research and found that there was only 16 part-time showers and restrooms for 7,500 unhoused neighbors in San Francisco, and that was 5 years ago. We believe that access to water and hygiene is a human right. We have seen just how important a shower is specifically, as well as access to hand washing and toilets. But showers, there's a really special quality about a shower. I think you all know if you don't take a shower for a few days, how that affects you. And imagine we see people not showering for a year that come to see us. So it's pretty transformative and really, really powerful. The other thing I just want to say too that, if you can't get clean, how are you supposed to get a job? How are you supposed to find housing? So it is a key critical component to a person's forward trajectory. And we get stories all the time on people who come back and say, thank you so much. I had to interview I had a job interview, or I had to talk to my case manager, or I had to just go to school and I didn't want to smell, right? So it's very, very simple, but incredibly powerful. And the stories that come back to our team over time is very heartwarming. Okay. So I just want to talk a little bit about the experience at Lava Mae, which I think is fairly unique as a service provider. This is actually a trailer in Los Angeles. This is in front of St. Francis. And so, when we bring bathrooms and showers on wheels to the streets, it really helps and encourages people to rekindle their dignity, their self-worth, and really unlock the hope and opportunity that comes with being clean. So what happens is you walk up to Lava Mae, we give you a 15-minute shower. We don't turn the water off. We don't tell you to, get out after that amount of time. We knock on the door. We give you a towel to borrow. We let you have hygiene kit items. And really what we have learned and what's really important for Lava Mae is what we call radical hospitality. So what that means is you have compassion and you offer this service in a very humane and loving way. And that's really the impact that we see with our guests. And that, to Talia's point, when you establish trust and relationships with people and you treat them as humans, it's incredibly powerful and impactful for this audience or segment that never gets treated in a very humane way. And so that's the transformative piece. So having the service, but then how you deliver it is just as important. So a lot of people would probably think that Lava Mae staff spends 80% of their time cleaning or driving the rig or restocking, and that's actually not true. I would say cleaning, driving is about 20%. 80% of our time is spent listening and talking to our guests, understanding their stories, helping connect them to resources, being their friend, and they don't have a huge support community and friend community, and we become that. A key piece of that is, as I mentioned, the consistency, so showing up at the same time, at the same place, with the same staff, as well as the compassion. Just to give you a sense of our impact, we're celebrating our 5-year anniversary in June, and we have served over 18,000 Californians, more than 65,000 showers. So between Los Angeles, San Francisco, and Oakland, we've probably served 50 different service sites. And when I say service site, that means rolling up literally like this next to a church. That's next to the community cabins in partnership with the city. That is next to other like civic institutions such as public libraries. And then also in the case of Oakland, which is actually a new model for us as well, is with the business improvement districts, because it really is about the community business members, unsheltered neighbors, residents, government, cities. That's when you all align together, that's where the impact is. Okay. So I do want to say, as part of our ripple effect, starting 5 years ago, we were the pioneers for this in California and really throughout the US. We've also inspired or assisted 130 other mobile hygiene programs modeled after ours. The only reason why I'm telling you this is not to give ourselves that much prop, but what we decided is that based on this, when we launched, we got so many phone calls and emails from governments, from organizations that said, hey, can you bring your service to our city? And we said, we wish, if we could only scale up to meet the need of every single city and every single state and or country. So we said, well, my gosh, if so many people are interested in bringing this model on wheels in a mobile way to their communities, we need to create a toolkit. We need to educate people on how to do this, because with 5 years of experience, we wanted to leverage that to educate and mentor. So we've launched our replication program. We launched about 1.5 years ago. We have a free open source toolkit for anybody that wants to learn how to do this. It sounds easy when it says toolkit, but it's not really plug and play, but we kind of like to sell it that way, and then we'll kind of teach you through the tougher pieces. So that is one of our core programs, and we are happy to teach and mentor going forward. I'm going to actually end on this slide. I just want everybody to remember that there are human faces behind this service, and really how you think about access to sanitation, not just as a transactional access service model, but as a relational model, and how to leverage access to sanitation as a core gateway to other services for outreach, for rallying for the community is really key. One of the challenges Lava Mae also faces is just, you talked a little bit in the beginning about education. There's a huge lack of awareness and education around how underserved in terms of access to sanitation is. I think really making sure that we're able to educate people around and get the community buy-in as to why it's so important. Lastly, I'll just end this piece with saying that really one of our key thoughts and opportunities that came to mind is really providing a thoughtful and humane response as a community. So we've really learned that people rise to the level of care that they're given, and that when they feel safe and seen and cared for, they make more rational decisions because they can actually think. And that's really what allows them to persevere and have that resiliency through that forward trajectory to kind of hold them in place until they get the job or get housing or whatever that next step is for them at that point in time. That's it, thanks.
Thank you. Thank you to all three of you for the work that you're doing and for sharing that with us. If you don't mind, Chris, let's stay with you for a little bit. Just a question that comes to mind for me, and hopefully others in the audience, is if you could talk a little bit about, so you're currently doing work in San Francisco, Los Angeles, and Oakland, and it sounds like you're providing this toolkit to other areas, and maybe how the program is evolving in those other areas, what you're seeing as new practices or best practices that are emerging in that context. And then if you want to talk to us a bit about how we can help fill in some challenges or gaps that you're also maybe identifying.
Yeah, so you're talking about specifically for kind of where Lava Mae's programming is evolving going forward.
Exactly.
Yeah, so, for us, we just want to get more showers on the streets. Our goal is to get every community up and running because we know that the most sustainable solutions come from the communities themselves. It's extremely hyper-local. Talia, as she mentioned her segment in terms of what the unsheltered or houseless guests look like is a very different segment than what it looks like across, it can even be block to block, like in San Francisco, right? So our goal is to mentor and train. We see other social entrepreneurs. We're getting a lot more phone calls from cities and governments that with the additional HEAP funding are trying to figure out programming-wise how to use that in terms of mobile hygiene. I think there's still a huge challenge around the collaboration and the collective impact. I think this is mentioned in one of the slides. How do we figure this out together? But the core thing is to start with your guests. Start with what the people on the streets that are unsheltered. Some of them are in shelters or on the streets or in their vehicle. What success and satisfaction means for them in terms of the service you're offering and how you offer it. And if we can all come to the table to do that together instead of in silos, that to me is the biggest win, because as we're seeing now, it's such a public health issue that The Atlantic Monthly published an article about 2 months ago on the return of medieval diseases, and some of them were mentioned already. And really that's because they're living on the streets in extremely unsanitary conditions. And how do we, as a community, address that and be accountable to that across NGOs, government, funders, et cetera.
Great, thank you. A question for you, Talia. I'm curious, you were talking about the geographic focus of the City of Oakland, how the City of Oakland has taken the sort of geographic approach to offering these services. And can you tell us a little bit about how Oakland has approached identifying where those geographies are or prioritizing communities based on a certain set of criteria?
Definitely. So first, the visibility or the sheer numbers of homeless folks in Oakland has increased, and so there isn't an invisibility problem. I think we were facing that, maybe 10 years ago in certain pockets or certain neighborhoods, and it was really outreach teams that were on the ground and were able to develop those relationships. As development, gentrification, and other sort of displacement issues have occurred in Oakland, you're going to see larger and larger encampments that are far more visible. We still have our pockets, or like in our channelways around Lake Merritt, for example, we'll have encampments that are sort of hidden away, or the Caltrans properties, right? So there's jurisdictional issues that come into play, right? Where the City of Oakland, there's Alameda County, there's Caltrans, there's the East Bay Mud Flood District. I mean, it's like, but really it's still all in the borders of Oakland. So to us, outreach, porta potties, whatever, doesn't matter like officially whose property it is. We're going to work with those. Those are our residents, regardless of who claims. Oh, there's the railroad and BART too. So these are all the different jurisdictions we're navigating. So our geography for the community cabin sites specifically, those choices had to do with where properties were available for us to open the programs. Those are all leased properties, other than the Miller site, which we opened in January. Those are not city-owned properties. So it was like, well, what do we have available? Let's look at what's where, and then you go, sort of work backwards from that. And we rejected properties that weren't near encampments, right? So we weren't going to open something up where we didn't have the ability to invite an entire community, a cohort that was already living together, to come be together. From there, we opened up invitation zones to expand once those encampments had moved in. As people moved out, we moved more folks in, invited people. It's all voluntary, just to be very, 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 very clear. Nobody is mandated to participate in community cabins programs. For the porta potties portion, it's been me. I'm kind of a one-man band around it, or one-woman band. I've done a lot of outreach. I'm on the street a lot with my outreach teams, public works, on my own. I understand where the encampments are. We have encampments that are just a few people and they have porta potties. We have encampments that are, dozens of people and we have porta potties. There's not one criteria, we look at the feasibility of service. Can United get there, right? So we have encampments that are along the railroad tracks, for example. I would love to have porta potties there, but United will not drive along the tracks. They're not going to go on railroad property, right? So there's different things like that. So the ability to service, our porta potty sites are hand in hand with the garbage service. The Human Services Department, my division's been really staunchly against putting porta potties where Public Works won't come and pick up debris piles. It's essential for the service and the sort of meeting clients where they're out and making sure there's a holistic approach to the encampment sanitation and health. So that's been a barrier too, because their capacity's been limited. As they've been able to ramp up, so have we been able to ramp up. And then there's sites that move on, right? We've had porta potties at sites that organically and really without, I mean, some of it is city intervention, you know, where we close encampments or things like that, but there's also organically sites that sort of disappear. During the rainy season, you'll see more under the highways, and then when it's really sunny out, you'll see more in parks. So it sort of depends on that. Those are the different things we're looking at.
And this might be obvious, but would you say that the city still has a large unmet need in terms of providing access to sanitation? And if so, how are you meeting that? What's the plan ahead?
Yes, it's not enough. We have to do more and we have to do better. That's like hands down to everything in the Human Services Department and then in my little niche of homeless services. What are we doing? I think we're looking more and more also to brick and mortar sanitation, sort of looking at businesses opening up for unsheltered folks, looking at new buildings having mandates for that, businesses. So that's a policy piece that I'm not involved in, but those are conversations I'm hearing. Certainly, I mean, the city council, what's really been great in the support we've had, our funding for all of the health and hygiene intervention, well, aside from Public Works debris pickup, for us Human Services side is all either HEAP money, and previous to that was all general fund money. So it's unrestricted. So it's really flexible for us. We obviously don't use HUD funding for any of this. So, or the cabins, for example, not a dime of federal money goes into them because we're non-compliant with HUD regulations. So, but it allows us a ton of freedom. I mean, it's like we're able to be flexible and creative and innovative, because I think that some funding streams really discourage that in a lot of ways. So HEAP funding and general purpose dollars have definitely allowed that for us. The expansion of curbside sanitation is also going to be dependent on the United services. I mean, I'm seeing you use United, and they're making who knows how many millions of dollars from, right? And you're using United in San Diego too. So, you know, what's interesting, I'd love to get their leadership of California services. I mean, I've met with their Northern California regional leadership team. It would be great if we could get them at the table and really talk more and more about how their capacity is going to meet the need, because they're essentially the front end service provider. I mean, we do all this support, but I don't know that they have trucks to keep serving sites 3 times a week. That's what we do, is 3 times a week for most of our sites. If needed, we'll increase it to more. I mean, and that's the feedback loop that we get from our unsheltered residents.
On that last point, thank you. On that last point around sort of consistent maintenance, Keith, maybe you can tell us a little bit about how LA County is approaching not just the placement of these sanitation service centers, but also their ongoing maintenance, and what maybe some of the challenges there are and what the approach is that you're taking.
Sure. So those initial placements, and again, there were just 4 that we had. 100-year-old agency, that was our first porta potties other than at a construction site. Those were chosen based on where the encampments were near our waterways, as well as where our health services identified the Hep A outbreak. As we've moved past that, there's still an interest and need that we continue to provide these services. And so we are kind of analyzing how best to do that and where to expand it. And we're trying to kind of balance that with our ultimate goal that we would have, you know, activation along all of our channel rights of way with public open space that has these type of facilities. But as you look at how you fund that, it's really a matter of some cooperation with all those cities along those right of ways, some, I hate to say policing, but some security, outreach force. I mean, we've talked about this kind of River Rangers program where you have both security, education, outreach, kind of you know, for both ecological interests and security interests, being a kind of help wayfind people and that kind of, and that's an effort being led by the state right now to do a study on that. But some form of that where it could be a multi-agency cooperative effort to look at these. And then from a funding perspective, likewise, you have to be joint funding. I think there's opportunities through the counties, $400 million a year in the Measure H. The city of Los Angeles has a similar measure that they're generating funding from. And then there may be opportunities with our recently passed Safe Clean Water program for water quality, where you have these TMDLs for bacteria. Perhaps there'd be a link to funding there. Whereas now, the trash TMDLs, there's certainly links to go in and prevent trash from accumulating and washing into our waterways.
One more thing that I failed to mention is something we're looking at. Adding to that is the concept of hydration stations. So it being water. I love your solar light thing. Totally bringing that home. The wash stations, the porta potties, and then somewhere to charge phones. So really creating sort of like this little service station that's available for people. So it's sort of creating a more robust than just the porta potty units and wash station. Looking at what else you can bring to that little configuration.
No, exactly. That's on our radar as well, especially with the where those areas are to hydrate. There's an opportunity for messaging and education about where does your water come from. Los Angeles is a big part of the local water supply.
And I think I heard this correctly, but correct me if this is wrong, Talia. The city of Oakland has provided, in some instances, stipends to some unhoused neighbors to be able to actually engage in maintenance as well. Is that something that the LA County has considered or would maybe consider?
That may be something the county considers. Is this outside of my area of expertise, as really just focusing on our flood control district infrastructure, and that's really out of our authority. But we are, as we look at our master planning upgrades, we're looking at the housing impacts, and those may be things that come to play from our regional planning department when we look at ultimate impacts and how we're going to offset those if we provide enhancements that may raise rents or otherwise impact the populations near our infrastructure.
Thanks. So I'm just going to kick this one open to sort of all of you, and you can take a stab at it. But being that we're, representatives of state, local, and regional agencies, also some NGOs here, can you talk to us just kind of broadly about what you think it is we can do to help sort of shape solutions to some of the challenges that you're seeing, whether that's through fostering more partnerships through funding or thinking about some of our own regulatory programs in the context of supporting the work that you're doing, lending some of our engineering expertise or scientific expertise or outreach expertise for that matter, just thinking through some of the potentials for collaboration with folks that are in this room or joining us online for that matter.
I think, as you mentioned, all having a seat at the table and really talking about how we are meeting the need collectively and having co-impact goals around that. So it's not just one person or agency is doing one thing and an organization is doing another. I think also looking at all the reporting requirements and time it takes to act for nonprofits to actually put together reports and the funding that comes to nonprofits. Costs are rising for us as well, so having support around looking at, the amount of money that we're getting, to provide the service, as well as the reporting requirements, and looking at how to be a little more kind of, flexible potentially through that.
I think for us, and outside my wheelhouse, right? So that's my disclaimer, is really how for us municipalities can work better with East Bay Mud and water providers locally. We have not, until recently, I made some friends at East Bay Mud and we're working, and I think those first relationships are on the ground, personal relationships that you build. Like the nature of the work that I do, and that's how I know how to do it. And then you build up from there. But the buy-in from like water providers is really important for us. I don't have, like at the community cabin sites, we don't have access to running water. We've not been able to leverage that relationship or be able to somehow get it going. We provide water at the sites regularly, obviously, but we don't have running water. And how to be able to like be at better at ease and helping mobile showers coming to more spots in the city of Oakland, because it's such an issue. It's high cost. It's a lot of permitting, all this other stuff, like a lot of just hoops to jump. Feels overburdensome for both us as a municipality and our NGOs that we're trying to partner.
I would agree with that. It's trying to figure out all the different pieces and where you need to go to actually be permitted. You know, is it Department of Transportation for parking permits, mud, all the different pieces. Then also just being really creative and innovative around the current, water infrastructure that we have. So, we can roll up and we usually attach to a fire hydrant or a hose. I mean, it's as simple as if the water's there, we can use it. Or are there other portable solutions, that we can kind of think about? Or how are you thinking about brick and mortar, but leveraging or having more accessible, our water fountain, simple as that. Or just more accessibility around public restrooms that aren't being used, that there could be a broader use for that across a broader population. So just thinking about the service models in an innovative way, both from a mobile perspective and from the brick and mortar perspective with the infrastructure that's there.
Thank you. Can you each tell us a little bit about some of the metrics that you think we should be incorporating into how we're evaluating our ability to respond to sanitation needs and to actually provide services? What are some of the ways that we should be measuring success or not, and what should we be looking at long term as we're evaluating our ability to do this?
Okay, go ahead.
Right. No, from a perspective of where we are now in expanding access along our right-of-way for community benefit, there's kind of this dichotomy of the encampments are discouraging the local users, the sanitation stations being provided. We actually haven't had any pushback, but in other areas where they've thought about adding restrooms, there's been some concern about that. So I think the success metrics would be when you have those facilities and they're really used equally by the local community and those that may not be sheltered, and neither is use is degraded by the other. They feel uncomfortable about it, but it's that long jump to get there from where we are right now.
Thank you. Anyone else want to add?
I mean, so I say this as Talia Rubin. I don't know if I'm wearing my city hat as I say this. It'd be great if we had a porta potty for every unsheltered community. I mean, I think the same thing that we're talking about, the right to water, as you're saying, I think it's the right to showers. I think it's the right to go to the bathroom somewhere safe, clean, and accessible. For me, though, there's a tension between curbside solutions and where our investment is in people actually being housed. And, as funding, there's just an ongoing tension with that, I don't know if other municipalities are feeling that. I know we are around policymakers and advocates, or, there's just this tension around resolve these encampments, moving people into these short-term solutions. That is not the solution to homelessness, right? And so I don't know. There's a tension there, and as much as I want all those services to be there, as Keith was showing the cost, right? Can we support people moving into permanent, or increasing our housing inventory, or creating true tiny homes, not community cabin shelters, but can we get innovative and creative in that way to increase our actual housing options? And is that our best use of funds is what I'm constantly grappling with that.
So I think one of the, I think I mentioned this before, one of the core metrics is just how satisfied is our user, is our guest in the whole experience, right? They are who we're serving. So I think that's the key. You know, one of the things we talk about at LAVMA is, you know, do they actually feel healthier over time? You know, regardless of if they actually are, a lot of it's a mindset and it's the hopefulness and they feel better. And you know, how does that play out over time with the access to showers, to sanitation, et cetera? And then the really kind of much more kind of forward thinking is, because they have access to showers and sanitation, are people now getting more jobs? Are they getting housing? What are those actual forward trajectory metrics that we can say, because of this critical service, here's how it informed kind of the longer shot.
And do you know of any sort of examples or case studies where we are seeing that trend, that progress trend, where the increase in access to sanitation services might actually lead to getting that job or getting that home? Do we have examples of that type of tracking locally that you all are aware of?
Nothing formal. I mean, there's ways for me to run those, like looking at specific cohorts at a certain encampment that had shower services, like Fifth and Webster would be a good example. We have porta potties there, we have the shower service, and it's a cohort that we engage with on a regular basis. But and other than anecdotally knowing personal stories, we're not tracking that. It's a really difficult thing to track.
But I would say, to Tali's point, because I just completed a grant report where, you know, Tali and I, you know, I can say, here's how many showers we gave, and she can tell me from the city's perspective how many people from the community cabins got jobs or got longer term housing or actually received DMV licenses. So the more you can combine programming and have that humane response together, where you have community cabins for at least 6 months, you have wraparound services, and then you have showers and hygiene delivered with what we call radical hospitality, which is that compassion and empathy that layers onto that. For us, that model has been a beautiful model for us to see and to, you know, bear witness to. And so we'd like to obviously continue that.
So I can think of at least a few ways in which I think the state can probably offer some support, whether that's through, you know, providing more support for infrastructure or through funding for things like housing. But what are if you have any sort of ideas in addition to that about how the state specifically might be able to provide support, whether it's through tracking metrics, providing data, developing, you know, other ways that we can support these local solutions that are really emerging and can be scaled up and should be scaled up? Any thoughts on that?
Well, I guess one of my thoughts is, I mean, I think what is the baseline for what we're measuring against, right? And how are we baselining that against all communities, and where does it need to shift given certain communities and landscapes? Because LA is very different than Oakland, very, very different than San Francisco, right? So us as providers, how are we coming to you with a standardized set of metrics that we are then judging ourselves against and can track with our guests based on what you all consider success from a sanitation and access perspective?
Thanks.
Yeah, I'd just say, you know, obviously funding for those type of programs where you have that, you know, linear parkways connecting communities, that you can also provide these sanitation stations, access to water, shade, et cetera, would be helpful.
I was worried that the answer would be simply dollars, money. Thank you.
Well,
that too. If you all could just offer, as we have about 5 minutes left, a little less, any closing thoughts, closing remarks before we wrap up?
I would just say that as a really newcomer to this issue, having, you know, been involved in providing these services for really just over a year, it's really helpful to hear forums like this. And we're working with our partners in the county side that deal with this regularly, but it's you know, quickly coming on to the forefront of our planning efforts. So this has been helpful.
And I would also say, just providers that are on the ground, like Lava May, really being informed on what these initiatives and pieces are, so we can hook into that and know how to, and we can tell you our thoughts and findings, and then you tell us your policy, and it's like and maybe we can help with policy around that based on us being on the ground, et cetera. So, it's the back and forth, I think, working.
I just want to say, I'm still learning so much about where we fit into these larger systems. And so it is really a brilliant opportunity for me where, I was in encampments all day yesterday, and then I'm sitting here presenting, and that feels really amazing to me to be able to communicate up and to be able to receive the information that you have. So I think working on more of that, and having heard the speakers that already spoke was a ton of information for me also. So I just really appreciate the invitation and participation.
And I just want to say, this has been very educational for me as well. So thank you all for being here today. I mentioned that I do sort of equity and environmental justice work and work with tribes. And I often get the question, what are you doing with respect to homelessness and the housing crisis and displacement, particularly working with a lot of communities, actually all over, whether it's Fresno, Modesto, Stockton, Los Angeles, the story is the same. And so it's really, enlightening for me to hear from all of you, and I can't thank you enough for the work that you're doing on the ground. Thanks a lot, and it really helps to also inform our approach and my work, so thank you.
Welcome to AT&T's teleconference service. Please enter your access code, followed by the pound sign.
For coordinating this.
Yeah, of course, and thanks for your flexibility. I did have one quick question. So I'm not too familiar with Sky's business, but in the past, Okay, so the forward to them. I'm just worried because
So good afternoon. We're going to go ahead and get started. And good afternoon, everyone. My name is Nicole Morgan. I'm with the State Water Board's Division of Financial Assistance, Office of Sustainable Water Solutions. And so what we do is something a little different, but definitely somewhat related in a way. So we provide technical assistance, low-interest loans, and grants to public water systems that serve small disadvantaged communities to provide long-term solutions for safe and reliable drinking water and wastewater services. And so we want to welcome Lahela and Chris this afternoon. We're going to be talking about the funding pathways, and so state, local, federal, and also private. We were lucky enough to hear about the great work Chris was doing earlier today before lunch. And so Lahela is also with us this afternoon. For those that were not with us prior to lunch, I want to definitely introduce Chris again. Chris Kepler is the Senior Director of Strategy of Strategy and Programs. She leads strategy and programming and impact evaluation for Lava Mae, a San Francisco-based nonprofit that brings mobile hygiene and other critical services to people experiencing homelessness. She also spearheads Lava Mae's replication program, which trains and mentors communities to create new mobile hygiene programs modeled after Lava Mae's. She has worked with Lava Mae for 2.5 years. Prior to Lava Mae, Chris spent 20 years playing dual roles as a strategist and creator of physical and virtual experiences for private sector clients. Her experience includes serving as a traditional planner at ad agencies, a digital user experience information designer and strategist, and a service program designer at brand agencies. She joined Lava May to bring her skills to a very underserved population, our unhoused neighbors, with the intent of creating innovative, compelling, and empowering programs and experiences that make a direct positive impact in their lives. So we also have Mahala Maddox joining us. Mahala is the local government liaison of the Homeless Coordinating and Financing Council, also known as HCFC, and the acting grant manager of the Homeless Emergency Aid Program, HEAP, a $500 million one-time flexible block grant. Ms. Maddox is responsible for providing technical assistance and establishing partnerships with local governments and continuums of care and other stakeholders. Prior to joining HCFC, Ms. Maddox served as chief of the certification unit with the Department of Healthcare Services, Mental Health Service Division. Ms. Maddox has more than 20 years of experience in social services, mental health services, and other related fields, both in Hawaii and California. And her career includes service in nonprofit, local, and state government. She is passionate about building partnerships and working collaboratively to strengthen communities. When she isn't working, she enjoys stand-up paddleboarding, hiking, and dancing hula. So with that, I'm going to ask Mahala, and she has a presentation. I'm going to get that going and turn it over to her.
Oh, are we on? There we go. While we're getting that set up, there is a handout in the back table and my business cards, and the handout in the back is a one-sheeter about the council. So I'm just gonna kind of give some highlights about it. You can grab it after, because I mostly want to talk about the funding. But that does give you some good information about, there we go. Who the council is, what we do, and how we were established. So I'll just kind of go through that really quickly. So the Homeless Coordinating and Financing Council is an advisory council pretty much. It was established in 2016 with SB 1380, which was signed by Governor Brown. And there was a few, well, not a few, there's actually 13 mandates in that statute. But the council is responsible for implementing the Housing First policy throughout the state. We also have some mandates for data warehouse system and a few other things. And so if you are familiar with the council before, it used to be with HCD, the Housing and Community Development Department. And then in 2017, Governor Brown signed SB 850. And that bill moved the council to the Business Consumer Services and Housing Agency. And it also assigned permanent staff to implement the mandates of the council. It added a few members to the council. It also designated the secretary of agency as the council chair. And most importantly, it established the HEAP program, which they mentioned in the previous panel. And again, which is a $500 million one-time block grant, flexible funding that was distributed throughout California. And I'll talk a little bit more about that later. And then most recently, SB 918, which is the Homeless Youth Act, was also passed by Governor Brown. And that is also placed under the council. And that's really to evaluate and establish programs and identify funding for our homeless youth, which is a growing number. So that's kind of that in a nutshell. Again, you have the one-sheeter that gives you some more information. So I know that the previous panel, I didn't hear the first panel, but they gave a lot of statistics and information about their particular cities like Oakland. And I'm going to give you a little bit more of state information first, and then I'll talk about how the funding came about and what kind of funding there is. I'm also representing our federal partners that weren't able to come today, so I'll give you a little bit of information about funding at the federal level as well. So homelessness in California, these are the 2018 numbers. The 2019 numbers have not been published yet, but for 2018, California did have a slight decline in our homeless population, which was 1.2%. However, We continue to be first in the nation when it comes to the number of people experiencing homelessness. 25% of the nation's homeless population, so the entire nation, 25% of that population is in California, despite us only making up 12% of the country's population in this state. We have the highest homeless numbers here. We have the highest number of unaccompanied youth. We have the highest number of veterans and chronically homeless in the United States. 54% of all unsheltered homeless unaccompanied youth are in California. 50% of all unsheltered veterans are in California, and 49% of the unsheltered chronically homeless are in California. So again, even though we've seen a very slight decline, we continue to be the highest state in the country. So there's a few myths about homelessness. One is that people come to California when they become homeless because, you know, we have good weather and different things. The truth about that actually is that most people experience homelessness close to where they lost their housing. Most have been residents in that area for 10 or more years. And again, most live within a 5-mile radius of where they are now homeless. People are homeless because they choose to be homeless or because they have a drug addiction or a mental health issue that keeps them homeless. The truth is that California has an extreme shortage, not just of affordable housing, but I mean housing in general, but specifically affordable housing. And it's extremely difficult to treat your medical conditions when you are unsheltered. Another myth is that if we provide, and kind of point of why we're here is that if we provide toilets, washing stations, showers, that it will encourage unsheltered individuals to continue to be unsheltered and live on the streets. And that just simply is not true. Access to water and sanitation is a basic need, and human beings have the right to those. And a lot of, you know, panel 2 talked a lot about that, right? It's about dignity, it's about how we feel. And so a lot of times we associate housing and basic human rights with what people deserve, right? Well, folks don't deserve those things. That's their right to those things. It's not conditional. If you do this, you get that, right? Housing and sanitation are things that we should have as a human right. Homelessness impacts multiple systems. I mean, you can see it here, right? People are like, why are you going to the Water Resource Board to talk about homelessness and funding? Well, because we have found that it crosses all systems, right? Transportation, water resource, a variety of other things. Unsheltered individuals are very expensive for communities, and they have severe consequences for our individuals who are experiencing homelessness. You know, people living without shelter lack the access to sanitation services. You know, people say, well, if we provide them with trash bags, like it'll just encourage them. Well, they don't have trash service like we do, right? So people want to know, well, why is there buildup in trash? Well, because nobody's coming every Monday to pick up their trash, right? Like we get in our houses. So without those services, and I think Talia shared earlier, like people now use encampments, like the general public use encampments as a dumping site. So then it looks like it's the folks who are, not to say that they aren't contributing to the trash, but it looks worse than it is when really it's our general community contributing to that as well. Homelessness is a statewide crisis impacting multiple systems again. Our homeless individuals incur the largest medical costs throughout the state. In 2017, Caltrans spent over $10 million in 1 year cleaning up encampments. So just imagine, like, if we provided housing and these basic needs, it would offset those costs that we're spending in other departments. Again, health and safety is a huge issue, obviously, for our unsheltered population. Those with underlying health conditions and disabilities face the most serious risks. Them getting to treatment is often very difficult, if not impossible, for them to do. Lack of water causes serious health problems. For people in general, but especially for women, it causes additional, obviously, women have additional issues that require sanitation and clean water, and that exacerbates medical conditions. They're also at high risk for communicable diseases like hepatitis A. They talked about that earlier as well. We saw that in 2017, right, and in several of our large communities with hepatitis A kind of running through our unsheltered populations. And these are really expensive because typically this population is also accessing our emergency rooms. Emergency rooms are very expensive, right, when we get to that point because they don't have regular medical care. What's the solution? Housing. I know that sounds super simple, and that's what people think. I mean, if we had housing, then we would have less sanitation issues, right? However, we also know that housing is going to take us a while to get there. California just does not have the capacity right now to house all of our unsheltered, and so we need interim solutions until we can catch up. I mean, in general, a lot of communities have like 1 to 2% capacity for housing or stock in housing right now. And then as you saw, like with Paradise Fires, right, they were already at less than 1% for housing capacity, and now they have 0. So those, and you know, like in Sonoma, that was 2 years ago. They're still building. They're still just starting to build in some of those areas. So those obviously impact our housing capacity as well. So what can we do in the interim? You know, one of the things here for the water resource, right, is that they had AB 685, so it establishes the human right to access water, but some of the challenges are that we don't have regulations, there's not consequences, there's not funding associated with that, so who's gonna pay for sanitation? The other part of the solution is understanding how systems interface, right? Which is part of why I'm here. How does homelessness interface with the water resource and you know, and Caltrans and things like that? And so it's understanding that. So I was at a conference this week, and so Tia Boatman-Patterson made a really good analogy, right? And you heard this one the other day. So we think of a pie, right? So everybody has to share this pie of funding. Well, inevitably, you can't split the pie equally. Somebody is going to get left with the crumbs, right? Like it's not equal. Somebody's always going to be shorted. However, if we think of it as a potluck, right, and everybody brings their resources, some of our most successful communities, the reason they are more successful is because they are doing like a potluck model, right? It takes water resources, it takes the housing authority, it takes everybody that has some type of resource, whether it's dollars or not dollars. Resources don't always equal money, right? Resources can be other things. The city can have the resources of, you know, moving through the permit process, right? There's other things that can be provided as a resource to help us other than actual dollars. The other is raising awareness and understanding, like the myths that I talked about. Sometimes the barriers come not only in our communities, but with our policymakers as well. And it's educating folks on the impact and the reality of what happens at ground zero, like what's happening on the streets, and how do we really make an impact, and how do we really put our resources together. The other is enhancing collaboration and bringing new partnerships. Again, we have to figure out how to put our resources together and stop working in silos. And then understanding what the resources are and how do we braid those infrastructures together to then address homelessness and sanitation issues. All right, so now we'll talk about funding. So funding for homeless services actually like throughout the country is through continuums of care and coordinated entry system. Do people in the room know what a continuum of care is and what a coordinated entry system is? No, okay, didn't think so. There's a few of you do, because I recognize a few of you. So the continuums of care, there are 44 now in the state of California. They are mandated by HUD. This link at the bottom of this kind of gives you more information. So while they are federally mandated, they kind of operate, they can decide who they are, but they basically cover a geographical area throughout the state. And then that's how your federal funds and even some of your state funds are funneled into homeless services. They can be made up of local stakeholders, local government, law enforcement, a variety of people make up the COC, and they kind of basically determine how funds are used within their communities. They decide which projects are going to be funded with these dollars, and they're kind of work a collaborative effort to address homelessness. The coordinated entry system it's basically like the gateway for our individuals to access services. So the idea was that and this is also HUD mandated. So before, you know, people would just go wherever to get services. Well, now the idea is that we have one entry point, which would expedite services, ideally, if we had enough money and enough, you know, services. And then it's to ensure that people people are identified and that their level of need determines housing. So it's not necessarily, or the services that they get. So it's not necessarily based on first come, first serve. It's based on risk factors. And so the providers kind of use this system. They do assessments, they do risk assessments and things like that. All right, so now we get into the, so again, those are kind of how those are how services are provided and how funding flows through the state of California. So this is where I get into the HEAP funding. So in 2018, there was a very large housing package that was passed in June of 2018 by Governor Brown, and it was a variety of funding. So these are probably three that you hear a lot about. It's HEAP, CASH, and No Place Like Home. CASH and No Place Like Home are administered by the Housing and Community Development. So I'm not going to talk a lot about them because it's not really my my area. But with HEAP was extremely important, and that's what I'm going to talk to you folks about because, again, they were mentioned it earlier, and that is the funding that could be used for sanitation services. So HEAP was awarded, again, it's a $500 million block grant. It was distributed to the 11 large cities in the state of California, which as of January 2018, it was cities that had a population of over 330,000 people. This last year, it has now increased to 13 large cities, adding Stockton and somebody else, I can't think of who it is now. And then the 43 contingents of care. Last year, there were 43. One of them has split, and there's now 44. So $350 million was split between the continuums of care, and $150 million went to the 11 large cities. So there are other PowerPoints that I have on our website that go into lots of detail about HEAP, but this just kind of gives you the highlights. Again, those are the eligible applicants. Then what happens is when we disperse that funding, they then will do their local process to determine how the funds will be used. The funds are extremely flexible. They can use them for almost anything to fill the gaps in their community. They can use it for services, capital improvements, rental assistance or subsidies. They can use it for other, which is whatever doesn't fit into one of those categories that they need to use money for. The disbursement, you may be shocked by this, but it was upfront once their applications were awarded and funds were dispersed upfront. It is not a reimbursement program. So all of these applicants, all 54 of them, have received their funds as of April 3rd was the last check that went out. So typically, programs are a reimbursement rate, which can be challenging, especially if folks don't have the funds or the capacity to pay for projects. In this case, we released all of that money up front. It's emergency funding, so the timeline for the spending is really short. It has to all be spent by June 30th of 2021, so that's only 2 years for the program. The other unique thing about this funding is it mandated a 5% homeless youth set aside, so folks had to use at least 5% of their allocation to serve our homeless youth, either in new expanding programs or current programs. All uses must align with the Housing First policy, and we have information about that if folks are not familiar with that. But basically, a Housing First policy means that folks are housed, and it's not conditional. So they don't have to graduate from a substance use disorder program to get housed. They don't have to participate in services to get housed. Again, it's the basic right that people, if you are housed, you can then provide services and they can engage in services if they choose to. I'm not going to go through all these details. Again, you guys can visit the website, or maybe we can email this PowerPoint out if you folks are interested. But again, this just kind of shows the timeline. So the funds went into effect July 1st of 2018. We released the applications on September 5th. We received 2 applications that day, and then we began dispersing funds in October. So if anybody's familiar with getting funds from the state, that is unheard of. It typically takes, what, I don't know, 9 months longer to even get the contracts, to even get your contracts. So we awarded funds, we did standard agreements, and we dispersed the funds within 60 days of the application being approved. All right, so federal funding. So there's actually not federal funding specific to sanitation. So the federal funding that comes through California and most states is Emergency Solutions Grant, ESG, and Community Development Block Grant, CDBG. So you can include sanitation in when you use those dollars, but they are not specifically for sanitation, if that makes sense. So like you can use the funds for an emergency shelter, and then you can allocate funds for case management and outreach to teach folks about sanitation, to purchase garbage bags to leave in encampments. But there isn't funding specifically for sanitation. And that's where HEAP came into play, is that they could use those dollars for showers, toilets, hand washing stations, laundry services, whatever. But federal funding is not specific to sanitation. I think it's something that we are obviously looking at, and that the federal folks are looking at now that the number of encampments is increasing and the cost of cleaning up encampments is increasing. But I think federally, their view at this point is like it's more handled at the city level, at the local level, right? It's our local government's responsibility and state responsibility for sanitation, not necessarily federal dollars. Though, as we kind of move through these processes, it doesn't mean that funds won't become available, but there are some creative ways to use the federal funding for sanitation purposes. And some have done that. I'll kind of highlight a few programs like Contra Costa, who is using, kind of doing an outreach team that addresses sanitation. So a few things that we learned with HEAP that our previous panel talked about is that I want to just highlight is, establishing partnerships and collaboration and understanding what the resources are and streamlining those services. The state of California and maybe sometimes the cities and counties make it extremely difficult to access funding or to leverage funding together. There's a million different applications depending on what you're applying for. There's a million different timelines. There's a million different requirements. There's, the applications take hours and hours and hours and hours and days. And so, the state could do a better job of streamlining those, and HEAP was one example of that. Like our application was online. It took people less than 10 minutes to complete. And it was very, very simple, and we provided a lot of technical assistance. So I think you guys talked about that in the last panel, is how could the state help? And that's one area, though, HEAP is unique, and so that's not something that typically other state departments do at this point. So I just want to talk about a few project examples. So Contra Costa, they have a core team. It's called Coordinated Outreach, Referral, and Engagement. And so basically it's an outreach team comprised of various different, law enforcement, social workers, and they go out and they do outreach and they do education and they link them to services, and they assist with that sanitation. And lots of other services, but sanitation is one of those areas. So these are just some photos that they shared with us, a day in the life of street outreach. They have a program where the yellow garbage bags, they distribute these garbage bags to the encampments, and then they schedule for them to be picked up and cleaned up. These are some of their numbers and how they've impacted their communities. It's a little hard to they have serviced 3,300 unsheltered individuals or families. 49% of persons encountered placed in a shelter or a warming center, and they have removed 53 tons of trash through this team. So that's kind of how you could use like federal dollars, right, for sanitation. Some of the HEAP dollars, folks were interested in if anyone was using HEAP dollars for sanitation. We do have a few projects. Some are still in their award process, but we do have a few, and you'll see most of them are using them for mobile showers, portable showers, drop-in laundry services. Humboldt's upgrading their septic system to the city sewer system. They're providing supplies like water, lotion, sunscreen, soap, Tehama is increasing their showers and bathrooms and laundry services. So in general, when HEAP funds are being used, it's for these types of services and also to fund their outreach teams to visit the encampments and assist in getting those cleaned up. So the gaps in funding and resources, one is data. They talked about that earlier before lunch. The state of California doesn't actually track or have a system that tracks data. The COCs use HMIS, which is a HUD mandated, but that data bypasses the state. It goes from the COC directly to the feds, and then the feds issue a report. So California actually does not track. I mean, independently, some departments may based on the funding that they're doing, but overall, the state does not track data that we can follow, but that is where the council is working on that. The other, obviously, is funding. People typically don't think of the need for funding for sanitation. I think it's one of those areas, well, someone is doing it, right? Well, who's the someone? The someone is us in this room. Permitting is a gap. It takes the cities sometimes to no fault of their own, sometimes, it is, but permitting things can take a really long time, not only for sanitation, but for housing, for, interim housing. It can just take a really long time to get through those processes. The other is access to facilities and services. So they don't have access to sanitation services 24/7. Sometimes the location is difficult for them, and there just simply is not enough facilities for our unsheltered population. So kind of to close, what we know is that homelessness is a social problem with a variety of underlying economic and social factors. We are kind of in, a housing crisis and extreme poverty, and that's just the reality of where our state is. Combating homelessness has to be a priority, and because it touches so many systems, and it clearly is a health and safety issue for not only for them, but for communities in general. And we need to demonstrate compassion. These are the most vulnerable people in our society, and we tend to criminalize them and view them negatively. But I encourage you to remember that oftentimes there is someone that that is homeless or could be homeless tomorrow. They are someone's father, mother, brother, sister, children. And so, those myths are what create, challenges in our communities. And so I just want to encourage you folks to, to practice compassion. And then the other is partnerships. We really need to partner together to identify resources because that's necessary for substantial impact in our communities. So this is our contact information. We do have 2 funding brochures for folks that are interested. It kind of identifies like a project that you want to do, what kind of funding is available, and which department oversees that funding. So there's 2 documents that kind of walk you through that that are available on our website. So that's it in a nutshell.
Okay, thank you, Lavanya. So Chris, earlier before lunch, you provided some of the history and the background of the great work that Lava May is doing. Can you talk to us about the funding side?
So full disclosure, I'm not actually the development person at Lava May. That's our founder, Donnie Sandoval. But I will give you a little bit of background on our funding structure and just where we collect money from, so to speak, the different groups. So we kicked off our fundraising in 2013 with an Indiegogo campaign, which is similar like crowdfunding campaign. And we raised $58,000, and that was to basically launch our first bus. So that was to launch the bus and to retrofit it. So as I mentioned, we had 2 buses before we moved on to the trailers. Our Lava May is very lucky in that Donise is an expert and has a huge background in branding, marketing, and PR. So what she did is she launched the campaign, and then she really used the visibility of media outlets such as, the New York Times, Fast Company, SF Chronicle to really tell this story in a really compelling way, and that's what got us a lot of eyes on it. And that also brought in more interested individuals that wanted to donate. a lot of the visibility has also yielded a lot of opportunities in terms of partnerships and in-kind donations. So a lot of what we rely upon also is in-kind donations in the form of hygiene items, towels, and other partnerships where they can donate, other services to us. What's been interesting for us is kind of the journey between then and now. So for the first 4 years, our funding mix was essentially 40% corporate, 30% individual, and 25% foundation. So we actually do not take government funding, or we have not in the past. And then the remainder of that is really from third-party fundraising. So that's people hosting events on our behalf. 2017 was the first year that individual giving outpaced corporate giving, and mainly that was because we had an anonymous donor that contributed $1 million to us to scale up in Oakland. So this one donor is the reason why we are able to be in Oakland. And that's been such an amazing experience for us to add another full locale to round out 3 of the largest cities in California. We've sustained Lava Man's 6 years of philanthropy. But it's been a struggle. We're definitely seeing a shift in giving. Our theory is that between the impact of the 2017 tax laws on smaller donors who can no longer deduct charitable contributions, right, and also with what we call the uber wealthy and big foundations, who are really being advised to focus entirely on upstream or root causes, right? So the big bets. The big, 2 years from now, what's the big impact shift that's going to happen through your donation? So what that means is that the right now services are being impacted pretty significantly, more than we've seen before. So what we're realizing, and it's really kind of key, and what we're advising people is that, really for long-term sustainability, government dollars really have to be a part of the mix. And that addressing the crisis really requires that everyone be at the table in terms of funding, government, private sector, foundation, every certain piece. There's an accountability across the board for the community. So I just wanted to give that background.
Okay, thank you, Chris. So you did talk a little bit about private sector and foundations. Was there more that they could do to focus on sanitation issues?
Well, I think we just can't. I think we can't currently solve this just by depending on 1 or 2 sectors. Access to sanitation and showers is a public health issue, and I think, as you were saying, it's really about how are we all coming to the table in a potluck style, from a funding perspective, from a service perspective, from a collaboration co-impact perspective. As I mentioned, with all the public health issues and all the diseases that are on the streets, it's about your community and how are you supporting your community and everybody that's in that community, regardless if they're sheltered, housed or unhoused.
Thank you. Well, Lahela, so you said that, I believe you said that HFC is working on tracking outcomes. And so do you know how you plan to use any of the metrics to track and improve sanitation outcomes?
Yeah, so there are reporting requirements for HEAP that we are tracking, and so we're looking at how folks are using those dollars. The large buckets are capital improvements, and so capital improvements would track the building of showers, and that includes even mobile, because we consider that a capital improvement, because they would be, purchasing a van and then upgrading it to have showers or laundry services, and then the other category is services, which will be tracking that as well. So technically, though, the reporting requirements for HEAP are not due until January of 2020 is the first report that's due. However, we are tracking that internally to kind of see where folks are using their dollars and how they're using their dollars. We met a couple weeks ago with our federal partners, with HUD and with USICH, which is the United States Interagency Council on Homelessness, to really talk about what kind of funding and technical assistance and tracking that we need to provide. And so again, the cost of encampments and sanitation wasn't on want to say it's not on their radar. But again, it's that piece of funding, right? Where the expectation is that our local governments, our state, our private partners, local businesses, public safety, law enforcement will provide that funding. So I mean, ultimately we'll be able to know how many. But I think you talked about it earlier. It's hard to track exactly what those outcomes are. It's more about the bigger picture of how many folks went from unsheltered to sheltered, or how many folks in general just access those services. So again, if the state doesn't track that, and I think your recommendation earlier of having some type of baseline and standard of best practice is where the state plays that role, is how do we drive those outcomes and expectations.
To follow up on that, do you know how the federal programs view the sanitation outcomes?
I think the AHAR, which is the annual report, which is they break it down by the nation, and then they highlight particular states. So there is some minimal reporting in there, but again, I think it's historically not something that folks tracked before, just because it wasn't as visible. There weren't as many issues. There weren't as many homeless people impacted by homelessness. And so as that has grown and that's become, more visible, now it's on people's radar, right? So while we have that momentum with our federal partners, it is time for that conversation. A little late, to have it, but I think that they are open to that and understanding that they may need to provide some technical assistance to our communities and how they can do sanitation. But again, it's that partnering with, what can water resources do? What can transportation department do? Who has, resources to contribute?
Okay, thank you. And so either one, are there other funding models out there that you know of that you can share with us?
Well, I alluded to a company before. It's company called, for example, Good to Go, which they're attempting to increase access to toilets in commercial and retail outlets, and they're very socially conscious. So they're actually donating some of their funds to nonprofits like us. So how are you increasing access, and then using those funds to kind of give back to nonprofits that are doing this sort of work. So that's one idea, one.
I think on the state side, and this is where the community comes into play, is advocating for these dollars, right? And it's the community and other partners collectively coming together to the state and to different councils and boards and saying, this is what our community needs, and this is how, we need to do that. So historically, state funding has been lower, and most of the funding comes from, the local jurisdictions, like the cities, like LA has Measure H that they passed. It's the cities and the voters passing them individually. So, with HEAP, it's the largest investment, one of the largest investments that the state has made. And it infused a huge amount of dollars into the communities, and I think that's where the mayors, they lobbied basically to Governor Brown and to the legislature and said the state has got to pony up money. But on the flip side of that, he had a requirement that folks, if a jurisdiction wanted to be a direct recipient of HEAP funds or wanted to use HEAP funds in their area for capital improvements, they had to declare a shelter crisis declaration. And that was a challenge for many cities initially because of the controversy and what that means if they declare that. And that's where the education and the communication piece comes in, because it was, well, then does that mean we're just going to have tents everywhere? And so, well, how many emergency shelters are you building? And that's not really what it was. The intention of them of needing to declare that was to say, if the state's going to pony up $500 million, the cities need to be on board too, and the cities need to contribute funding and to be on board. And some, a lot of cities do, right? City of San Francisco, I think they spend $300 million or more, annually, right, on services. So in the scheme of things, the state's money is like a drop in the bucket when you consider the amount of money at the local level that is contributed.
That was kind of a long answer, but.
So I actually have a question. Lava Mae's gotten a lot of calls from a lot of cities that are wanting to start up mobile hygiene service programs because, especially in relation to the youth funding, they have more money to spend on this. So the questions that they're asking me are things like, this money we have to use by X time, but I don't know if I'm going to be funded for this program after that. I think some of the tensions are between like, do we as a city, or even as a county, multiple cities purchase one or two or three shower trailers and work together to provide services, and instead of just finding a vendor, right? So like, I guess I have two questions. What are some of the thoughts around ongoing funding, given that there's this big infusion and then you have these programs that are up and running, how do you sustain them?
So yeah, and that's a huge conversation. It's one-time funding versus sustainability, and that's the challenge for our communities, right? The challenge for the state is that, while we have funding now, if we have a downhill swing, will that funding continue? So the danger of doing on the funding side is that if we do it ongoing, how is that going to be ongoing? How is the state going to sustain those dollars? The challenge that it provides for our communities and our providers is that they never know how much they're going to get, or they never know if it's going to change. And so it's challenging for them, even for housing, right? It's challenging to do affordable housing because the developers and the lenders want to know how much money and how long is this money going to be around. And again, that's really where the communities collectively, and the continuums of care, they have to lobby for that, and they have to go to the legislature and say, we need ongoing funding. One-time flexible funding is great, but one-time funding causes a lot of challenges for our communities. So regional approaches are great. Cities that kind of work together to then kind of, again, pull their money together and provide a service for everyone rather than holding it for themselves and only servicing their, small area.
I have more questions. I don't get to talk to you at all. This is fun.
Take my card.
No, the last question is, with now there's not, like, for example, there's not enough mobile hygiene kind of vendors, as outlets or services for cities to have an RFP or contract with. So what are you noticing that at all that cities are now actually having to take on programs themselves and manage those programs with the money? Like I'm noticing again that there's, trailers and things that they're actually talking about purchasing with the heat funds instead of contracting it out. Is that a common, I don't know, I'm just curious, is that a common thing that you're seeing now? Is that cities are having their own kind of programming around this instead of having vendors kind of go and take care of these different pieces?
Yeah, for sure. I mean, you'll see that, in LA and Oakland, the cities are really the ones kind of driving the encampments, and they're, cleaning them up and then relocating folks. And part of that is because they have the authority, I guess, if you want to say, right, to permit those activities, to do the notices. And so they are taking those on because that's where their resource comes into play, is that when you clear an encampment and relocate folks, it's a long process. Like it doesn't just happen tomorrow, because you have to do outreach not only to the encampment, but the area that you're going to relocate the encampment to. And so the cities really need to drive that process because they have the authority to do that. They can get together waste management, and they get together law enforcement and all of those people that need to be in that process. Because typically what happens when you do an encampment is that you identify a zone, right, that you want to address. And then you have to outreach to the encampment and do outreach and let the folks know this is what's going to be happening. And then you have to outreach to the community to say, okay, we're going to relocate them, we're going to clean up your streets, we're going to do all of these things, and we're going to move them over here. And then while we're doing services here, then we're going to transition them to housing. So again, the city really is the one driving that. So you'll see, you see that a lot in LA and San Francisco, Oakland, obviously our larger city, Santa Clara, because that is where the bulk of the encampments are. But I think for sanitation, it's that mobile is great because we do need to go to them, but but mobile has limitations too, right? As far as access to hooking up or who's going to operate that, right? And so there is a call to like expand or reopen like our public facilities, our public restrooms. And the cost of doing that, I think is cheaper. I mean, we definitely need the mobile because we're not going to get rid of encampments tomorrow, or shelter all of our unsheltered. So again, we'll take all of it to do that. But yes, the cities are definitely having to put more. You'll see cities start to identify homeless coordinators embedded in their systems. You'll see that in law enforcement. Slowly but surely, those things are happening in systems, and that's because they hold that responsibility.
Thank you. Final question. Looking forward, are there any additional funding needs for sanitation that you anticipate being significant?
Go ahead, you take that one.
I mean, yeah, the funding is funding, and we need dollars, and we need, and I think like when we were on our call last week, it was like, what are the resources that we have, and how do we use what we have, right? Because we can't always come up with more dollars, and I think that's the idea. Is when we look at, Caltrans spending $10 million in 2017 in 1 year to clean encampments. If we could switch some of our thinking and how we approach those things and how we match those dollars, we would be more impactful. But when we have this group over here doing this, and this group over here doing this, and that one doing that, because at some point we don't have enough money. Everybody doesn't have enough. The state isn't the solution. The feds aren't the solution. The cities aren't the solution. I mean, there is no one entity that is going to solve these situations. It really is collectively those pieces. So, I mean, in general, yes, we say more funding. I think one of the things is like when you do, a bill, right? So what is your guys' 685 or 682? There's no funding attached. We did SB 1380 for the Homeless Coordinating and Financing Council that has 13 mandates, but there's no funding for staff. So who's going to do that? There's no funding for services. Then we introduced ASB 850, which, we come up with the $500 million, and that's general funds, just so people know. It's not federal. There's no other dollars with that. It's just the state's general fund for that $500 million. And then we have, Governor Newsom has announced another $500 million. It's not HEAP dollars. It's actually for a different type of program. But that trailer bill language is out there right now for public comment if folks are interested. That funding's for emergency shelters and navigation centers and a few other things. Yeah. I mean, I think it's just, again, it's identifying the resources we have and figuring out how we use them together in the most effective ways. The other folks that have, access to dollars is law enforcement and the fire departments. And I learned that from the sergeant down in Santa Ana, and he said, we are the first responders. Individuals experiencing homelessness, it's a public and safety issue. So we have to have those folks at the table to tap into public safety dollars, right? So it's kind of being a little bit more creative in how do we use resources. Again, not only dollars, but what power do you have at your organization? What power do you have if you folks are community members? What power do you have as a legislature? I mean, you have to think, Santa Ana's been really successful, not Santa Ana, but Santa Clara, because they finally figured out, well, they pointed fingers, and they self-admit this, I mean, this comes from them. They pointed fingers for a while, right? Like, well, you do this, and I can't do that. And it wasn't until they realized, okay, well, the housing authority has housing vouchers. So I'm going to come to the table. It's the potluck, right? I'm going to bring those. Then the city said, okay, well, we have the authority to do this and to expedite that, or oversee this. So we're going to do that. Senator Beal's staff are at their continuum of care meetings, and they actively participate in those conversations. And what can they do, and what can he do? And then it's the continuum of care taking their funding. And so people can say, well, they're rich. Right, Santa Clara is rich, so that's why they have more resources. But it's not about. I mean, it's partly that, but it's really about what can you do as a community member? Can you support affordable housing? The myth is that, well, if we build affordable housing, then all these homeless people are now going to be in our community, and we don't want them there. Well, do you want them on the street, or do you want them housed? I mean, Do we want them to be safe so that we can provide services? Do you know how hard it is for you all to get to the doctors, right? If you're unsheltered and don't have income, do you know how long it takes to get to an appointment? You just don't go. You don't get those resources. And so it's just having that, you know, sitting back and saying, what is my role? What is my resource? What do I have to offer? How can I support? Can I go to a community meeting and voice my concerns in a constructive way? And then how do I contribute to that, right? Sorry, I'll get off my soapbox, but I could talk all day.
Okay, thank you, Chris and Lahela. I want to thank you both for your time. It's been very educational. And I'm assuming you both will be available this afternoon for the public forum.
Can I plug one more thing? I'm sorry, I'm going to soapbox one more time. Because when we talk about homelessness and how to end or homelessness, it really is about prevention and intervention. The stats show that most of our chronically homeless individuals first experience homelessness as a young adult. Our homeless youth population is out of control. You know, I have a son that's 22. If he wasn't with me, he would be at risk for homelessness because they simply cannot afford to live and go to school and do those things. So that's really another population that if we want to talk about homelessness and how do we end that, and it's about prevention. It's about, you know, housing our most vulnerable people, and those are our homeless youth are adding to that. So when you just think about that too.
Okay, thank you.
Thank you.
So we're going to take a quick break and come back in 10 minutes.
Welcome to AT&T's teleconference service.
Hi, Suzanne, is that you?
if everyone could take their seats, please, I'm going to start back up. My name is Geeta Kapai. I'm the Director of the Office of Public Participation for the State and Regional Water Boards, and I'm here to moderate this next panel. This panel is Roles for the Water Boards. I'm going to start first with someone we have on Skype, and I will give you a brief bio, and then Suzette, if it's okay by you, we'll have our conversation with you, and then I'll go to my other panelists. So Suzette Shaw is a grassroots activist, bold, persistent, and inspirational poet, blogger, and womanist who stands in her feminist naked truth. Pull yourself up by your bootstraps was a philosophy that was instilled in Ms. Shaw by the strong work ethic she saw in her mother and grandparents. Ms. Shaw has worked 2 to 3 jobs while carrying a full load studying health science education at Arizona State University. While studying at ASU, Ms. Shaw worked in the campus health clinic, supporting clinicians and piloting programs. Nevertheless, her drive and ambition did not equal a college degree. She went on to move to the Bay Area, where she resided for several years while living in Northern Carolina for nearly 2 decades, just like,
Northern California.
California, it's a typo. For two decades, just like her college experience, she oftentimes wore many hats, endured cultural clashes, and long commutes to keep a roof over her head, yet leaving her depleted. Ms. Shaw also ran her own business in the 90s, employing others with an above average wage that far exceeded the livable wage for that time period. Yet, despite Suzette's drive, tenacity, self-reliance, and even periods of success in life, she went through also immense setbacks and challenges to the extent of ending up homeless. As Suzette reflects back now in her midlife, the struggles she and even her family have endured, weathering were traumatic, and every setback has caused long-term health and life challenges, which persist today on the journey of healing. Thankfully, Suzette's trials and tribulations have not waned her, not because of, but in spite of. She now dwells in permanent supportive housing in the downtown LA community she now calls home, Skid Row. Welcome, Suzette.
Thank you so much. Glad to be here. Honored.
So I think what I'll do with this panel is I'll start with you, Suzette. As an advocate, I'm going to ask a few questions, and perhaps you could tell some of your stories, and then we'll go to our researchers and continue on with my other panelists. So based on your experience, what is needed to improve access to sanitation for people who are unsheltered?
Well, everything fundamentally boils down to people need to be housed. The basic human right or human need is housing, because without housing, people's lives are just shortened, and everything starts with someone being housed in order to be able to put their lives back together and move forward. Hence, a lot of the sanitation issues that we deal with people living out on the streets, environmental issues, public health issues would be extremely minimized if people were actually housed, and then they can move forward with actually healing and putting their lives back together, such as myself.
Thank you. And Suzette, what can be done to improve safety at sanitation facilities?
So there's quite a bit in as it relates to sanitation issues. One is that the streets stay extremely filthy, I'll just have to say. According to United Nations standards, people living in Skid Row are living in less than third world living conditions. And so some of those public health and sanitation issues is the fact that people are living amongst so much trash and sanitation and public health issues, from fecal matter to urine to airborne diseases, which that in turn happen from tuberculosis to typhoid, meningitis, respiratory infections, hepatitis, on and on and on, just because people are living in a very unsafe and humane environment, while also living outside and living inside, living outside really in very close proximity to so many heavy populated community as well. I would also go on to say that with some of the sanitation issues also have to deal with the fact of lack of hand washing people having access to hand washing, and safety issues, lack of just regular water, to drinking water, to cleaning their hands, to being able to bathe in a humane way, and just really basic things that we take for granted. Honestly, we are conditioning people so much that the inhumane and the absurd is literally becoming normal.
Thank you. What changes do you hope for from this workshop, Suzette?
I'm hoping to broaden people's awareness and their willingness to want to help us in taking action. There was a publication that that was produced through the research work that we did with No Place to Go within the last couple of years, and really brought awareness to the lack of, at that particular time in 2017 when we started this report, there are approximately 9 public toilets for all the hundreds of people living out here in Skid Row. So hundreds and thousands of people, there are 9 public toilets. So according to United Nations standards, there should be a minimal of 1 toilet for every 20 people living in from their third world living condition standards. So we have to be aware of, we need people to be housed, so we need assistance and service with helping to support housing people. And we also need, that's the long term and that's the overall goal of ours. Within this 47 approximate square mile radius of Skid Row, we have hundreds and thousands of people living out on our streets on a daily basis, being exposed to, I just got back from a 2-hour walking tour in Skid Row, and just for myself, I was, just really parched. And getting dehydrated just walking in that amount of time. So imagine if somebody is living out in extreme conditions and being exposed to the sunlight, to the air, and a lack of access to just being able to have water to refresh themselves. Like I was able to, when I came inside, I was able to go into, the restroom and to freshen up and put water on my face and hydrate myself, my skin, as well as, be able to drink water. These are just basic human necessities that we all need. And I think in terms of, one is when people are living or displaced into poverty and homelessness, people tend to die 20 years earlier in life. So there's an overall quality of life issue that we have a cognitive dissonance awareness of how just people, the overall survival of people are going through. And how we are also dealing with the fact that, we have an aging population out here. So in Skid Row, most of the population, for instance, such as women, middle-aged elderly women are the #1 demographic who are displaced into poverty and homelessness, not just year after year, but decade after decade. So when we think about those intersections and how those ills that also minimize the overall long-term quality of life one endures, simply because they had no place to go and they don't have a home to call their own.
Thank you, Suzette. Another question. What have you seen work and what has been less successful and what could be improved upon?
So what I have seen work and what I know works is, prior the city, and I've heard elected officials, including the mayor, say that we thought this was their problem in the past. So this is part of the pathologizing that has happened to continue perpetuating the issue and the problem. Now I see the mayor, elected officials, and others taking a paradigm shift, slow paradigm shift of how we have to be conscious of not being reactionary, but being proactive and trying to be part of the solution rather than continuing the problem. And with that, since this No Place to Go publication has come out in the last 2 years, there has been a slight improvement. The mayor and elected officials got behind supporting the fact of there's a refresh spot now where there's and it's one spot in the community, but it's a spot where people can go to take showers. There are toilets, and there's an overall place where people can actually go. Now, this refresh spot is one in so many that are needed. So we need at least another 29 refresh spots. Let's just imagine, like, if we had like another 29 refresh spots for just this proximity of community alone, and how that would help to improve that overall quality of life. Also, when we think about women, the fact of women who are middle-aged, elderly, young, old, what have you, the fact of when women are going through the changes of life, when women are dealing with their overall daily and monthly routine of just having to hygiene issues, of lack of access to toilets or restrooms, or privatization when they're actually able to access the restroom or toilet so that they can, take care of basic hygiene needs. This is something that, we have to think about as far as the humanity. Again, United Nations has said Skid Row and downtown Los Angeles, people are living in less than third world living conditions. So when we take into effect an account of we've got all this vast wealth around us, we've got so many people living in such extreme wealth and richness, and yet in the shadows, we've got people living in less than third world living conditions according to the United Nations standards.
So my last question that I want to pose to you, Suzette, in your experience, what are successful and respectful ways to provide information about sanitation availability to people who are homeless?
One is I'm sitting here at the offices of Inner City Law Center, and I just did a tour this morning, awakening people of the ills and the issues and the concerns. Adam Murray, who's the executive director of Inner City Law Center, he, co-facilitated this tour with me and this morning, and brought a lot of awareness to people, urban planning students, from local Ivy League colleges, law students, people who just moved here from San Francisco that have worked for elected officials. People just really have no sense of how people around them, are living. I oftentimes say that as a woman living in Skid Row, that, we're so sensationalized as who we are as a people that you oftentimes won't know who we are because we're so busy trying to hold on to our dignity. So we can be picking fruit with you in the produce area at the grocery store. We may be on the subway and the metro trolley with you. We may be walking down the street and end up at the light at the same time with you. And the media has oftentimes sensationalized who we are through the drive-by photography of who a woman is living in Skid Row, that you won't even oftentimes know who we are because we're so busy trying to hold on to our dignity and our quality of life. We may not have a penny or a dollar in our pocket, but we're going to, because we're not oftentimes going to be out there panhandling and asking you for money. But this is how, as we as a society and as a people have to then be incumbent upon really not creating NIMBYism, not in my backyard communities. How we have to be conscious of the fact of this is a right to all people. And as and gentrification and urbanization is going on in America, even here in Skid Row, we have to be conscious of the fact of, you know, wanting to create spaces for not just ourselves, but for the least, for the most marginalized, for those that we wouldn't even acknowledge who are walking down the street or living living on the sidewalk on a cardboard or on a bench or whatever the case may be. We have to be aware of and not just pathologize them or stray from pathologizing them, but ask ourselves why. What happened? This is someone's child. This is, you know, someone birthed this person into the world. This is someone's mother, grandmother. What happened that this person ended up out here? And this is what we have to be conscious of, even as good Christians, even as good religious folks, because again, we're so often pathologizing and them and they instead of seeing as we and us and ours.
Thank you so much for sharing your stories and very thought-provoking. I'd like to thank you, Suzette. We're going to continue with the rest of the panel in the interest of time, but
sorry.
Yes.
Suzette, do you still want us to show some of your slides? She has 12 slides that she was hoping to share.
And you're able to pull them up?
Yes.
Why don't you go ahead then?
Okay, Suzette, are you ready to share your slides?
Yes, so this is from the No Place to Go publication that was done through the grassroots effort here in Skid Row. And you can also obtain this online by Googling No Place to Go or to going to Inner City Law Center website. You'll find the publication No Place to Go. And I'll just quickly go through. The slides basically talk about, you know, women, a woman who is part of the advocacy work here in Skid Row, but also just talking about her experience, her lived experience of being pathologized and the fact of her dignity and her quality of life being lessened just because she's a woman living here in Skid Row. Also, just really talking about and showing the cleaning and the sanitation that goes on in the community, where the what am I doing here? I'm sorry, just trying to figure out what to do here. Where they actually come in and they actually do a cleaning in the Skid Row. And the fact that Skid Row is approximately a 50-block radius, there's approximately 10,000 people, and the majority of the people are African American, with over 4,000 being themselves homeless. Giving also the quick chronology of Skid Row and talking about the fact of this was an industrial community. And containment policies of 75 and the infrastructure issues that have started happening in the 80s, from the factories closing, jobs disappearing, the fact that, you know, black folks who are oftentimes, you know, last one hired, first one fired, to you know, the housing epidemic and, you know, people losing their homes. And then the drug epidemic and warfare also starting in the 80s. Big businesses then, you know, capitalizing on making housing or renting or it's become more of a commodity than an actual, like, really understanding the needs of the people. The public health issues that actually then intersect with homelessness and the Dirty Divide report that was done through Los Angeles Community Action Network, otherwise known as LA CAN, in 2013, that actually talked about Skid Row and this small radius of a community. Again, you know, you don't see toilets, access to toilets, access to water. You don't see the very basics that may and probably do exist when you get into the more gentrified area outside of the Skid Row community that goes beyond Main Street or Broadway, Main Street to Broadway, and then on where there's so many trash cans and so forth, for instance, where, on Main Street, where I actually live now, there's a pet store where, they actually have, they put turf down so that the pets have a place to do their business, and they put dispensaries so that people who have pets can pull plastic bags and do and pick up the matter after the pets have done their business. Yet we've humanized, and I'm a pet lover myself, but we've humanized a four-legged being while dehumanizing a human being. So these are some of the pathologizing that the report talks about. I'm building trust. There's a whole issue and need of building trust so that there becomes this penalizing, criminalizing, and pathologizing of who homeless people are, that we end up creating, I'm a writer, I had a column called Skid Row from a Woman's Perspective, that we dehumanize and we actually set up these ordinances, what I call updated Jim Crow ordinances of policing and criminalizing people simply because they don't have any place to go. For instance, in 2015, LAPD spent like $100 million, or, they accrued approximately $100 million just writing tickets in the community, from jaywalking tickets, ordinances like 5611, people have to carry a bag on their shoulder, people right to rest. If you stop for more than a certain period of time, then that gives the law enforcement a right to stop you and ask you who you are, where you are you on parole, are you on probation, or do you have any outstanding warrants? And the stop and frisk. So that's another methodology of stopping and frisking. And then while you're writing jaywalking tickets, there's so many people who are disabled in wheelchairs, or, who can barely cross a street here. And yet we write these tickets when we see people right in the intersection, simply because they don't have the mobility to get across the street before the countdown has completed. And so we write these jaywalking tickets as, just an example. And then oftentimes people can't or don't go to court. And then before you know, then a bench warrant is put out there for them. And then we just set up this whole series of begets, because now we've criminalized, and now, there's a warrant out for somebody who simply couldn't get across the street. So that's how we pathologize and minimalize who people are, and how we set up the division of the haves and have not, and who is worthy of and who is not worthy. We need to adopt principles and ordinances where we're meeting the basic standards, from the United Nations standards. We're meeting the very basic standards. We're actually trying to develop quality of life. And again, remember, keeping in mind that each person, this is somebody's mother, grandparent, father, a child. And I was a person living in a $500,000 neighborhood around the corner from the country club, and months later called Skid Row home. I worked in Health and Human Services and all of that, and ended up calling Skid Row home. So I wanted you to understand that I am that person as well, that I fell short for whatever reason. And many of the people that I've met, the women especially, my story intertwines with theirs by a single thread. So we have to adopt principles of humanizing and seeing our most marginalized as our neighbor and not a criminal. The mapping, again, the report goes through more of the mapping of the community and how we went about deciding where to go into testing and where to see and where to access. And then also, there's we were going into providers, and then there's the area of the consumer. And when some people who were supporting the report, some of them were, do-good white folks who come into the community who's a report. So when they would go and they would ask for access, they would, for the regular restroom that a black person maybe in Skid Row was offered, they would be whisked over to where there was a nice clean restroom that maybe the staff or somebody else used, that they would be given. So again, there's a pathologizing, who has access, who doesn't. Where, we're saying that, maybe a Black, poor, homeless person, well, we're going to count off a few slices of toilet paper and we'll give you that. But, we're going to let somebody who's privileged and maybe white, we're going to allow them in the restroom, and then they'll have a whole roll of toilet paper that they can have as much as they care to. And these are all broad stroke analysis, but I'm just kind of trying to speed through here. We gave narratives. I shared stories. We advocated for change. And again, the refresh spot coming to Skid Row has been part of that. The restrooms have been taken out prior in Skid Row. And we have two main parks, and the restrooms have been taken out. And now those are being added in again. Also, those green toilets, they oftentimes didn't work. So what public toilets we did have access to, they oftentimes weren't working. And now they have staff people outside of those toilets that are there during the daytime hours to ensure that they stay running, that they stay clean, and that they stay safe for the individuals out here. This is the refresh spot that was welcomed and honored, embraced by all elected officials, including the mayor. And it's as clean today as it is in this day that the picture was taken, because it's mandated. It's manned by community members who have been given positions and jobs. So again, this is how we help people to while we're blaming them for not pulling themselves up by their bootstraps, we create enterprises and solutions to help them pull themselves up by their bootstraps. That give a fish. I'm sorry, I'm not sure what's going on here. Is that the last of the slides? Okay, so that's the last of the slides there. There's a poem that I wrote that's also in the report on, I believe it's around page 29, that just talks about, who we are as a people and just the criminalization aspect of the pathologizing that goes on. And there's a poem that I wrote, Standing Tall for Dignity and Equality, and I'll just end with this is, I'm not a liberated woman, I'm just a woman who yearns to live free. I wish to live free from the bondage of inequality. I'm just so longing for equality that is yet to be. Yeah, we've come far, but how far we have yet to come. Women are still striving for their equal sum. And whether we're sitting in the White House at Donald Trump Plaza or up in Beverly Hills, to the lows of the Appalachians or the rundown sawmills or the Catskills, whether your zip code is in Beverly Hills or right here in Skid Row, human dignity should not come at the price for only those who can afford fair prices and exquisite means. I humbly tell you, my voice, it is my power. It fuels me each day, and it gives me the strength which surpasses none. Instead, it allows me to be more of my equal sum. But please know, I'm just one voice, and I've won no battles. The battles, they have just yet to be won. This voice is just another gift God gave to me, so I can stand tall for dignity and equality. I thank you for your time today.
Thank you very much for providing your voice. How do we top that?
Thank you.
I should have ended with you. But that being said, thank you very much. Let's thank Suzanne. So moving on to the rest of my panel. To my left, I have Mike Antos, who is a Senior Integrated Water Management Specialist with Stantec. He has 16 years supporting integrated watershed management and planning in Southern California. He holds a PhD in geography from UCLA, where he remains an affiliate of the Institute of Environment and Sustainability's Water Resources Group. Mike is a visiting scholar at the University of California, Irvine Department of Anthropology and a fellow of the Robert and Patricia Switzer Foundation. To his left, I have Dr. Laura Feinstein, who we introduced earlier today. In the interest of time, I'm going to move forward, if that's okay. We're honored to have you here. Sandra Lupian has 20 years of experience working in the nonprofit nonprofit, and public sectors as a communications and policy strategist on a variety of issues, including climate, environment, and natural resources, active transportation and public health, as well as in public radio as a news anchor and public affairs producer. Last year, she completed a Master of Public Policy at UC Berkeley, where, as a member of the Environmental Law Clinic, she researched and wrote on the issues we're discussing here today, serving as lead co-author of the report Basic and Urgent, Realizing the Human Right to Water and Sanitation for Californians Experiencing Homelessness. For the clinic's client, Environmental Justice Coalition for Water, EJCW. As a consultant to the clinic and EJCW, Sandra has continued to focus on this topic, and in February she produced and moderated EJCW's California's Human Rights Crisis, a webinar on inadequate access to water and sanitation by homeless residents. She represents EJCW on our panel. Thank you all for being here. So the title of this panel is Roles for the Water Board. So as we move forward, looking at how we might better work on these issues together, I was wondering if I could have each of you give 2 or 3 minutes on just general information, and then we'll go to some questions. Go ahead.
Thanks everyone for being here. Thanks for inviting me. I'm privileged to be part of the panel. So only recently did I join Stantec. Prior to that, I was at the Santa Ana Watershed Project Authority, which is a government agency that works in 3 of the Southern California counties. We were the platform through which the Disadvantaged Communities Involvement Program, which is a Prop 1 funded program through DWR, came through into the region. In that program, the goal was to communicate with members of disadvantaged communities, and that has a policy definition in California. Members of economically distressed areas, that also has a policy definition, and then underrepresented communities, which has no policy definition. And the state asked the regions to try to identify who their underrepresented communities were. And in our process of building the program, it was suggested to us that we consider all the people experiencing homelessness together as a community. And if we did that, what would that mean for us? And this became a key intervention in our region, not only because it allowed us to think about homelessness, but also to think about those who are experiencing homelessness together as a group. It also gave us the idea of thinking about a community as being non-geographically bounded. And that is another way that I imagine, this is a thing I'm contributing directly to the state board. This is something to think through about whether your policy structures allow you to recognize a community that isn't necessarily bounded by a census tract or a political geography. Anyway, so our work on homelessness really started from there, and it became a question of what is the intersection between watershed management and homelessness, and that led us to have 2 symposiums, one in Riverside and one in Fullerton, where we brought together the communities of practice who are seeking to alleviate the challenges of homelessness and homelessness in general, and those who manage various aspects of water, to just sort out where those intersections lay. And from it, I'm skipping past a whole bunch of work that a lot of people contributed. Really, the place we arrived at was that the water managers in various groups, various authorities, really do have a role in homelessness. It happens all the time. We normally do it without thinking and in no partnership with those who are trying to confront homelessness in other spaces. And that means that we are disconnected, often causing more problems than we're solving, often not solving our own problem in the process. And that really the point was that the water agencies needed to sort out how to become a junior partner in the broader humanitarian approach to alleviating homelessness. So that's kind of the space where I'm coming from. I'm now off into the private sector, but that was the work that was being done at SAPA. It continues to be worked on there among many stakeholders of that watershed. This disadvantaged community involvement program is being carried out throughout the state in various spaces, and other regions have taken on board this idea of those who are experiencing homelessness being a community, and this is happening in the greater LA area and the Bay Area. To my knowledge, those are the 2 that I know about. I imagine there's probably others that are thinking that way too. And it is an important intervention to suggest that this is a community that as a group could benefit from our work.
Laura? Do you want to? Yeah, just opening statement. Yeah.
I think the topic for the panel as a whole is point of entries for the water board to grapple with this issue about access to sanitation and hygiene for people experiencing homelessness. And I sort of see, obviously this problem is huge, and it's going to be tackled by a wide coalition of many different people, and the ultimate goal is always to get people off the street and into permanent shelter. But I think nonetheless, the water board does potentially have a little entry point into this much bigger issue. And I see it as sort of being two complementary entry points. One is around the human right to water. The state agencies, in particular, the two water agencies, DWR and the water board, have been tasked with this idea of thinking about the human right to water as they enact their policies across the board. And I think it's clear from today that people experiencing homelessness in particular are shortchanged in terms of access to water and sanitation and hygiene in this state right now. We've, I think, just heard pretty eloquently that we aren't even providing services that would be considered acceptable in a refugee camp for somebody who has been displaced in a country, in a war zone, which seems sort of extraordinary that we think it is out of reach to provide the kinds of services that people provide in refugee camps abroad. So I think, thinking about the human right to water for the water board and thinking about that not just in an aspirational sense, but in a detailed standard setting sense. What are we actually aiming to provide for every person in this country or in the state? And then actually starting to think about what are the resources it takes to get there? Starting to actually spell this out. Do we even have the resources available to try to get to some reasonable standard of service for people experiencing homelessness? I think is the first question. And then I think the second point of entry, which I think is smaller but does fit in there into that broader umbrella, is thinking about the regulatory and permitting authority that the State Water Board does have. I think a lot of local governments and cities are taking this effort upon themselves to try to expand the services they're offering, but there is also an opportunity there when, for example, issuing a permit to a stormwater permit to a public entity like Caltrans or a local government agency, to talk to them about, well, what are you doing in terms of offering public toilets? Stormwater is affected by open defecation. We have at least some evidence from San Diego that it is cost effective to not try to treat that stormwater after it reaches your waterways, but rather to improve your sanitation services to prevent that waste from getting into the water in the first place. So we have resources to maintain clean surface water in this state. Should we be using a portion of it to provide sanitation services, given that it helps maintain clean water and it also provides public health and dignity? So I think those are sort of my initial thoughts. I probably won't.
Thank you. Sandra?
Thanks, Gita, and thanks to everyone for being here for this important conversation today. It's an honor to join you. As Gita mentioned, I'm representing the Environmental Justice Coalition for Water here today, and EJCW is a statewide coalition, and in that role, it's been deeply involved in water work throughout California, advocating for Assembly Bill 685, which, as we know, provides for the human right to water in California, as well as in recent water affordability efforts. EJCW was the lead applicant for the Proposition 1 funded Bay Area Disadvantaged Community Involvement Program, and now administers funding from the Department of Water Resources on that program. And like Mike mentioned, in Southern California, also included the homeless folks in the definition of disadvantaged communities or in underrepresented communities in order to try to create a situation in which they were an addressable community deserving of support. And I think that's really important, and happy that it's happening throughout the state. So in the report that I co-authored for EJCW, which Gita mentioned, we found, like Laura has mentioned a couple of times today, that the first critical step to successfully implementing AB 685 is for the state to establish minimum standards for access to water and sanitation, and then to ensure compliance with those standards through a variety of approaches. And those are, as we keep discussing today, collaborative approaches across agencies, across jurisdictions, local, statewide. The state and regional water resources control boards do have a significant role in leadership, as well as more nuts and bolts to play in building what needs to be a robust collaboration. And it needs to really make sure that it includes people experiencing homelessness in the planning process from start to finish at all stages. So I really want to kind of lay the groundwork for this conversation and all conversations on this issue of, it's never enough to ask, how do we communicate with people experiencing homelessness about what water and sanitation services are available? That's too late in the game, right? We need to have that conversation, and it needs to move in multiple directions. So EJCW really advances a nothing about us without us approach to all jurisdictions seeking to provide unsheltered Californians access to their human right to water and sanitation. And, if we're going to create solutions that really work, that really address the problem that we're trying to solve, we need that input. We need to understand experiences like those of people like Suzette and so many other folks who have experienced homelessness, who are experiencing homelessness, so that we're busting myths about things like, well, if we put in a toilet, homeless people will naturally convene and camp then in this particular area. And we see that, that's not really true. There are many other factors that determine where people who are experiencing homelessness do want to set up their camps, where they want to sleep, and those things have more to do with safety, privacy, visibility, right? And not the fact only that there's a toilet there, but I bet you if there were one, people would be happy to use it. So we really need to bring those voices in so that we're targeting our solutions to the actual needs on the ground. So I look forward to continuing this conversation throughout the panel.
Thank you. So some of this has been touched on, but how can the water boards use their programs and authorities to improve access to sanitation for homeless people?
So a couple of things that I note, and I'm not sure exactly how this ties into programs, but I think there's space there. In California right now, this is on the drinking water side, but it's relevant. The California Public Utilities Commission is responsible for regulating private companies that send water to your house. And part of their regulatory structure requires lifeline rates. So if you are someone suffering economic hardship, that private utility is required to have a system to help make sure that you have your water. Proposition 218, which is the law of the land for public utilities, forbids a lifeline rate because you're not allowed to cross-subsidize your customers. So we have these two paradigms in California where it's required for private agencies that are sending water to your house, and it's forbidden for public agencies to do it. So there are some questions there about how resources can be made available for these kinds of programs that I suspect may be within the reach of the board. And then the other one that I was just mentioning before to someone, if we were discussing 100,000 Californians who were unsheltered because the big one just rocked Southern California, and they were all living on the streets and at the racetrack and in the parking lot of the mall, we would not be challenged for very long on how to provide them drinking water and sanitation, right? We would have structures in place, or we would invent structures to get it done really quick. So the question is, can we work through our emergency management authorities, policies, and partners to treat it in that direction, as opposed to imagining this to be some sort of chronic social ill, right? Let's run it through our acute challenge framework and see what we can do. So those are kind of the two things that I like to bring forward just to be thinking through.
Thank you.
Jumped forward to this question in my first comment, so I won't spare you reiterating what I already said. But I do think that it would be really interesting and valuable to think through whether or not there are more opportunities to provide for local utilities to be able to start putting in more public toilets and more public drinking water stations. And I would like to have a very careful conversation about Prop 218 and what it does and doesn't actually limit us from doing in terms of addressing public needs. This is, all roads always come back to Prop 218 and in discussions around water and trying to meet our collective needs because of this sort of idea that you're not supposed to, that everybody only pays for the service that they get. And so that doesn't leave any room left over to start to address all these collective needs that we have, which are things like public restrooms and public drinking fountains and et cetera. So, but I sometimes think that Prop 218 gets used like a sledge, or addressed like it is a sledgehammer, when in reality it is a more nuanced law than that, and should be thought about carefully whether the local agencies really are prohibited from doing these types of services. I think there might be some nuance there. And then, of course, there's always that fun topic, which is Prop 218 reform. Should we be able to take some reasonable amount of ratepayer money and use it towards things that have a clear public benefit and yet no one single beneficiary to pay for them?
Like the flow from a fire hydrant, he said. So I'd like to talk a little bit more about what the State Water Board can do from a leadership perspective, right? Because it's in a very influential role and in partnership with DWR on this issue. And there are many state agencies, including agencies working on public health issues, health and all policies. A lot of different frameworks can come to bear on this issue, but I think priority number one, as I said, has got to be establishing these minimum standards for access. And, I think it's incumbent on the state boards to take a leadership role in convening the right people to start having that very detailed conversation. And I agree, we agree at EJCW that starting with those UN High Commissioner for Refugees minimum standards for access to people in planned refugee camps is a great place to start. Why not start there? But really engaging the voices and the needs of people experiencing homelessness and helping to determine more carefully what those minimum standards ought to be. And I think it's really important to note, Laura, you've been talking about metrics. You started the morning talking about metrics. In order to understand kind of how many toilets do we actually need if it's one toilet for every 20 residents, we also need to really kind of take a step back and look at how we're counting populations of people experiencing homelessness, because I think there's broad consensus that the point-in-time counts are very undercounted, right? And so how are we better able to get a handle on what those numbers really are? People say they're 2/3 undercounted, or is that about, I guess you nodding, Leila? Yeah, so how do we really understand what our population is that we need to serve, and then can we figure out what these minimum standards are? I think once minimum standards are established, then the state could require cities to submit baseline inventories of publicly accessible restrooms that are open 24 hours, very important, as well as potable water stations, along with plans to achieve the minimum standards. And then require frequent reporting and updates to induce jurisdictions to comply with these minimum standards. And this is going to have to come in a variety of, I think, carrots and sticks, right? Tying compliance to eligibility for relevant state funds, whether it's public health programs, housing and homelessness programs, community development programs. And as Laura mentioned, I think I'd be interested in hearing from folks at the Water Board about potential to tie compliance to stormwater permitting processes. How could that work? Could that work? Certainly, as with any sort of state mandate, it will be up to the cities and municipalities to determine how they meet those minimum standards, but certainly the state could also provide leadership by researching and providing a menu of options. We've seen this happening with climate adaptation planning in the state, at the state level, and I think that model could make sense here. Somebody earlier mentioned, it was Talia from the city of Oakland mentioned that maybe Oakland is looking at tying new development permits for building construction to the provision of publicly accessible water fountains or drinking water facilities and toilets. And I think that's very daring and very exciting approach to potentially really take a look at, right? So how might that work? Could we assign points to buildings that do that? Could we fast track approval, make a faster lane for those folks, or provide tax breaks? So a lot of different options there, and I think it's time to get really, really creative.
Thank you. How can the water boards measure progress?
Well, I wrote this thing, it's like about 60 pages if you have some spare time about that idea, but it's called Measuring Progress. So you can look it up. And, so basically what we proposed is sort of using this framework that has been used successfully internationally, which is the idea of a service ladder, where you break out, you have your your aspirational goal, which is for everybody to have a high standard of access to drinking water, sanitation, and hygiene. But that doesn't mean you just measure everybody into two categories. Either you reach that standard or you don't. You also break out some intermediate categories as well. And so, somewhere in the range of 4 or 5, I think we proposed 5 categories ranging from totally unsatisfactory, which would be you don't have safe drinking water anywhere near where you reside, you don't have access to a toilet, you're doing open defecation, up through these marginal standards, which would be sort of something that can sustain life on a short-term basis, but it wouldn't be something that would be healthy or livable for the long term, up through moderate, where you can live with that. It's not ideal, but perhaps you have an outdoor standpipe for getting your water, or you have a toilet that's near where you sleep at night, but it's not in your home, and up to what we mostly probably enjoy, which is, having running water and a toilet in your home. And so I think, we need to get down to some specific details about what standards we think are reasonable and some categories, and think about how they align with the public data sets that we already have, so we aren't talking about some massive new data collection, and start tracking it and mapping it. I think the logical landing place for most of this is the Human Right to Water portal on the Water Board's website. It already is starting to track this idea about whether drinking water systems are in compliance, which is a good first start. But it isn't capturing yet affordability, and it isn't capturing access for drinking water, and it's not capturing sanitation at all. So we need to start rolling in some metrics and standards for those and tracking those as well. And thinking about things not just at the system delivery level, but also starting to think about where breakdowns in service happen at the individual and household level, because a homeless person lives in an area with a functioning drinking water system. Usually that doesn't mean they have access to that. So we need to add in that layer as well, the household and individual level problems.
Thank you.
I would just go back to a point I made earlier. This is one of the key spots where the current system is going to be challenged, because the frameworks we have rely on this data set related to census tracts, whether it's Callan virus screen or median household income. And in many cases, you'll have a piece of land in California that does not qualify for these specialized services or funding streams, within which are people somewhere on the spectrum of housing insecurity, whether they're unsheltered out or in the world, or some other aspect, they're in their cars or they're in their motorhomes or whatever, but they're in a census tract that does not qualify for all these systems. And I've seen this happen where a program that would reach them is declined because it's in the wrong census tract, right? And that has to get fixed. That has to get fixed.
How can the water boards leverage or use existing data to address things sooner? Mentioned, Laura, we currently have the portal, and it covers the safe and clean with the number of systems in violation, but we're still behind on the others. But
well, which things do we want to address sooner?
I mean, the challenge that we're facing is that we imagine the way to count is the number of faucets or toilets or billable accounts or something, right? And if we presuppose that that all of our data comes through a relationship between a utility and a person, we're going to miss everyone who is not in that relationship, right? So there has to be a way to think beyond the idea of subsidizing a consumer-supplier relationship between a public agency and a person, and think about them much more directly as a member of a California community, as a human being, to which we've suggested we all have a duty, which is this human right to water.
Yeah, I mean, I think we have so much room to start to sort out these questions about access to sanitation that really there's a lot of opportunity there. Just to even start to track, for example, where we are seeing, start to get together, for example, a good state database on things like where there are leaking septics, or at least septics that we aren't even monitoring. So we don't know whether or not they're leaking. Issues of course, leaking wastewater systems as well. Does that correlate to poor surface water quality? We don't actually know. We have a pretty good system for tracking bacterial exceedances in surface water. Does that actually come back to wastewater problems? And if so, what are those wastewater problems? Is it leaking sewage? Is it leaking septic? Is it open defecation? We don't actually know the answer to that, except for, I keep coming back to this, in San Diego they did do some careful testing and determined that the bacterial load in that area was specifically from human sources. They don't know if it's from sewage pipes or septic or from open defecation, but they do know the problem is human sources. So that we need to start figuring out to what degree this even is a problem. And then I think also one thing that's come up today is, we clearly know that people who are experiencing homelessness don't have adequate access to sanitation, but we don't actually know that everybody who doesn't have access to sanitation is homeless. So we know, for example, it's surprising that this hasn't come up, but there's been, efforts to sort of count human feces on the streets of San Francisco and Oakland and LA, and it is shocking. And, if you walk around in San Francisco or Oakland these days, it is everywhere. We don't actually know that problem is totally originating from people who are homeless. It's also pretty easy to see that there is a simple lack of public toilets and public drinking water in our cities at this point. We seem to have been on some kind of steady program to shut those down. You can't even, for example, BART has perfectly operational restrooms that have been closed, and everybody now uses the elevators in BART. It doesn't seem like we've really thought through this problem very well. So I would say we have a lot of room to start even tracking what is going on with access to sanitation in this state, where the problems originate, what our standards are, and then last, I think, starting to envision some kind of program that isn't just about this issue about offering sanitation to the homeless population, but generally, I think, starting to think about reinvigorating our public services. That we should be able to have public restrooms, and everybody should feel safe using them.
Agree with that. And I'd like to add another type of data that we might be looking at to help move things along is actually data related to how slowly California is actually building housing, and really understanding kind of what that gap is between what we need and the pace at which we're going to get there. That slide that Talia shared about how slowly Oakland is going, I thought was very powerful. And having that data available to really demonstrate, to kind of underscore like that housing first and meeting the needs for sanitation and water access are not mutually exclusive. Oh my gosh, I think I just said the wrong negative. But that they're separate. They can be separate, and they should be kept separate because they're both necessary. We can use that data to help make that case, and also use data related to, what are the public costs of not providing access to water and sanitation? What are the public health costs? What are the costs to cleaning up pollution? What are some of these other costs? And really, building the case for, yeah, we do have to take this action, and we have to take this action quickly. And then just kind of piggybacking on something you said, Laura, about data related to where bacterial pollution is happening and how we're thinking about that, and is it from open defecation, et cetera. I'm glad that we have the data in Southern California that says, yes, okay, in this case, some of this is human waste, we know that. But in some cases, I think we've all seen media knee-jerk reactions to, oh, there's bacterial contamination in like the American River, for example, and immediately the finger is pointed at, oh, well, the source must be the people in the homeless encampments along the river, when in fact now we're starting to see questions, and the regional water boards I know are looking at this very carefully and going to do some analysis and research to find the actual source. But it might be birds, so we don't want to create situations where we're using data to, scapegoat or demonize or criminalize people experiencing homelessness, because the result of that then is that we're immediately going to clear out those encampments, displace folks who already have no place to go, both no place to go in terms of places to live and no place to go to the restroom. So we want to make sure that we're using data smartly and we really understand as carefully as we can the actual causes of pollutants like this.
There's 2 reports down in Southern California, one in Orange County by Liberty Hill, I think, and then one in LA County. I don't know who did it, but the LA County one really stuck with me. They did a real careful analysis of the costs of homelessness, and maybe this got mentioned earlier today. I missed the morning sessions. It's a 60% decrease to house someone on public services. So the cost of putting someone into housing and then serving them is a 60% cost savings over engaging with them through law enforcement and emergency rooms. So there's a huge financial boon available to us if we can figure out how to get ourselves pointed in the right direction, which I think is a really important data set. And then the other thing I'd put forward, and maybe this, I'll save it for your next question.
Okay, so in the interest of time, our last question is, can there be interagency collaboration to expedite our processes? In other words, taking information from research and using it to inform what we do.
Yes, I think so. So one of the results of the work down in Santa Ana watershed is that SAPA, which is a joint powers agency, watershed manager and planner, is in a memorandum of understanding partnership with the housing authority of the city of Riverside, simply to work together on that intersection of mission that's related to homelessness. So where the housing authority's mission on homelessness and the watershed authority's responsibility for clean water, habitat, all that stuff, where those 2 things overlap, let's partner, right? And it was politically tricky to get it approved, right? That this is all very difficult conversation to be had in the political rooms, but it's there now and it's moving forward, and that region is heading towards a monitoring program to try to suss out whether the impacts are actually from encampments or not. So I think partnerships are going to be the key, and I think they are the path forward. It's the way to get these, it's to acknowledge that you have a shared interest first, and then start trying to build programs together, as opposed to trying to mesh programs that already exist, because that often has huge opportunity costs and whatnot. One other thing I meant to mention earlier, and I'll throw it in here, it's a little non sequitur, but maybe not. The supplemental environmental program may be extended, if it hasn't already been extended, to this, right? And I know that your permit authority also extends to the POTWs that discharge effluent, right? And the opportunity to work with that permit structure and those partners, and whether it's through a SEP or through other means, to have them support this is another possibility.
And I would jump in and say, it's not going to happen without collaboration. How can that possibly happen? It's not working in silos. It seems like we've been trying to do the work in silos for a long time, and we're starting to come out, and it's exciting. But one place I think that collaboration can be really important is when it comes to funding, right? One thing that I know municipalities face as a challenge when they're trying to implement new infrastructure like, brick and mortar restrooms, is the idea that there's no money for operations and maintenance. So they can get the funding for the infrastructure, but not for the operations and maintenance. So it's really going to be really important for agencies and partners to come together and look at all of their funding and figure out, okay, well, I have the funds for operations and maintenance. Where can you pull, or I have the funds for infrastructure, where can you pull from to help do operations and maintenance, or what can we do together to create a new revenue stream for this on an ongoing basis? Otherwise, we're not going to build restrooms. Nobody builds something if they can't maintain it. And that's really important. And I did just want to quickly circle back to something I said earlier when I was talking about this, the state needing to induce jurisdictions to comply with minimum standards. That cannot be an unfunded mandate. Yeah, the state does need to jump in and make sure to be helping identify funding sources, particularly for operations and maintenance of any new facilities that should come online.
Thank you. Any last comments?
Yeah, I think some of the opportunities that I see is potentially more creative thinking about that bridge between stormwater quality and offering sanitation services. I think there's a lot of opportunities for public buildings, particularly transportation, to be opening up and offering more restrooms. And I would love to see this presented in a positive light. I mean, I think one of the reasons why people find Lava May's program compelling is because it doesn't look like a dirty porta potty that you don't want to go into. It looks like a clean, welcoming place that people would be happy to use. And I know, for example, a lot of water utilities have been doing the Yes to Tap campaign. I would really love to see more presence of drinking water fountains and public toilets that are presented in a way where it doesn't feel like some terrible, dirty place that you have to go into only upon need, but rather a place that is welcoming and part of our public spaces that we all can appreciate. And I'd really like to see local governments thinking about opening up their public buildings, their libraries, and their schools, and their city halls, and so forth, to make sure that restrooms are available generally to people who need them.
Thank you very much.
My last anecdote is that Lewis McAdams Riverside Park, which used to be called Marsh Park on the LA River, is one of the big new river-facing, regional parks. When you used to go get a tour of the place, the first place they'd take you is the bathrooms that they had installed. And they would say, this is the first river-adjacent and accessible bathrooms for people who are enjoying the new bike trail, right? That was the first thing, the first tour at this beautiful park was of the bathroom, right? So here's a state agency that paid for the whole thing, that acknowledged the need for this. They were thinking of it in the context of a sufficient resource for recreational use. But it's clearly something that we recognize as a need, and they were very proud to show it off. So I think this is not a big gap that we have to cross. I really don't.
Thank you to my panelists.
So again, I want to thank everyone for coming. So we're going to go to the public comment period. And what we're going to do is to the one person who filled out the speaker card. Okay, some people have. Okay, so I'll do this in order then. I was going to say the person who filled this out gets to go first, and then we'll just go based on hand raising. But since a few of you have, we'll just do it in order received. Okay, yeah. So we're gonna send microphones around the room because we still have people on the webcast who will want to listen. So I think Mary, here's first.
It has been a really interesting experience to hear everybody's comments today. We actually work with a homeless population and in a waterway that is inundated with trash and human feces, and we do have a kind of a unique perspective on it. We understand the need for more services, and actually the water and the sanitation makes sense, but what's shocking to us is that this population is often the cause of the dirty bathrooms. They ruin the bathrooms, and they sabotage them, and so they're cutting their own nose off to spite their face. It's not the whole population. It is a few bad actors, and we recognize that. So how do you stop? How do you stop that? How do you stop the people who are just angry and disenfranchised and want to ruin it for everybody? They're damaging the opportunities for that whole population, and there are very needy people in that population. It's a frustrating dilemma, and communities can hire guards for the bathrooms. They can go in and clean them every day, but those are large expenses, and so and we haven't heard anything about that, and so.
So the staffing is incredibly important for us. We think having bathroom sanitation stewards, right? So it's not just about people cleaning the bathrooms, and we deal with the same, sorts of scenarios where there are certain situations where you will need to spend a half hour cleaning the bathroom instead of a typical 5 minutes. But I think that's a huge opportunity to engage with the population and also set boundaries and tell them what's expected, and just continue to serve them with the sanitation needs that they have, but also really use it as a tool to engage them with other services. Because it's kind of human nature. One day my kid's going to be a little, pain in the butt, and the other day he's going to be fine. So it's just part of, setting expectations, setting boundaries, but having that interaction and establishing that trust and relationship. Because the more you have that trust, the more we see that people treat the staffers also with respect.
May I chime in? This is Suzette.
So, all right, I don't want to get back into too much of a back and forth here. That's not the purpose of the workshop. This is public comment, which is meant for people who want to say their piece. We'll take notes. If you want to engage directly with other people here, please, I would ask that you do that after the finale of the workshop, because now I do have a number of cards. So. And I would ask everyone, keep brief. We usually limit these to 3 minutes. So were you Crystal? Okay, so, right, okay, great. And Mary will be followed by Brian.
Hey, I'm Mary Tappel. I'm here as a volunteer working, I work with the Parkway Coalition, and I've been involved in numerous, over 30 years, thousands of hours of cleanup along the Lower American River Parkway. And Crystal is right about that. It is a very small percentage who do a whole lot of damage. And the most effective enforcement I've seen against them is internally, and others who are camped near them. Why they don't care for that is because the law enforcement necessarily comes to those places more often, so do the maintenance people. And all of that heat, the others don't want to deal with. And so that is a self-reinforcing. But overall, whatever else we do here, we need to recognize that we have an overriding importance of clean, healthy, safe, inviting and accessible beachways, parkways, public parkways. All our water resources have to be accessible to our millions, literally millions of lower to moderate income youth and kids, as well as to their parents. And fundamentally, we need to have those people's, many large numbers of people's rights basically allowed to exist and to be recognized. These are environmental justice needing communities, many of them. They live near our water resources too. They tend to be in areas where there are a lot of homeless encampments de facto. And again, the enforcement by all sorts of our people, including the teams that spoke here. These all work together, and again, it's peer pressure that I've noticed is the strongest, but it needs absolute enforcement by all these other parties. And it needs a funding emphasis on providing for the young, because they're going to have to deal with our future of decades of continuing climate change, et cetera.
Thank you.
Thank you very much.
So next is Brian Courier.
So Mike, I wrote down my question before your talk, and I really didn't need to be here today. I echo his question on disadvantaged communities and how they're identified. I work at the Office of Water Programs at Sacramento State. We partner with DFA to provide technical assistance for drinking water for disadvantaged communities across California. And so brain's just spinning of how to solve that problem. And then, so thank you, Mike, for putting that much more eloquently. And then I'll also echo the couple of statements just made recently, that as a frequent paddler, the Lower American River and also the Lower Yuba River, if you want your eyes open, just take a slow paddle up the river, and you can see how the beneficial use of that system for the recreational user is impaired. So definitely echoing and sympathetic to those comments.
Thank you. Next is Kimberly King, followed by Alyssa Kesey.
Hi, my name is Kimberly King. I'm a renewable energy engineer with a background in environmental engineering. I'm also a member of the International Standards Organization Technical Advisory Group for community sanitation applications in the urban environment. Let me preface what I need to say to further dispel the myth that may not be of this audience's familiar and refer you to the 2016 12-part homelessness investigative report by the LA Times, Lisa's Biagiotti. That said, I want to reiterate and change perceptions about the homeless demographic. I'm actually an unemployed renewable energy engineer with a and I've been homeless and performing my civic duty since 2014 to put forth sustainable eco-sanitary toilet solutions. And also, I'm a little bit disappointed that innovative eco-sanitation or dry toilet systems that could reduce the stress on a municipal waste treatment infrastructure, preserving basically water resource, were not a part of this workshop. I'd like to say that there are actually some local eco-sanitation experts in the room today who could be happy to consult and help establish standards and creative revenue-generating sustainable solutions. But my question is, in the East San Francisco Bay Area, we are in an earthquake drought. The question that I wanted to ask the panel earlier was, what are we supposed to do 72 hours post-earthquake when people can't flush their toilets? Are people thinking about that?
I'll just say I think we could hold a whole separate workshop on that question. Are you, Alyssa?
Yeah,
Oh.
I'm Elisa and Kesey. I'm a program director for an international nonprofit that specializes in emergency sanitation and low-cost sanitation in urban high-density environments. And I worked in Haiti for 5 years after the earthquake. And so that was, it wasn't just the immediate challenge of sanitation right after the emergency, but it was also, how do you rebuild? And how do you build low-cost housing? And one of the gaps I'd just like to comment on today is we never really define what a toilet is. And there has to be a conversation that bridges something between a water-based sewage network, which is very expensive to build and maintain, and a porta potty, which, you know, the user interface issues on a porta potty are so terrible. Go to Burning Man, people dump them, light them on fire, you know, defecate inside all over them because they are so terrible. And I think we need to just think about like compost toilets, aspirational dry toilet technologies, and something more affordable. Even, you know, everyone deserves a home, even if it's transitional housing, maybe dry toilets are a way to get everyone a personal toilet, and that's my comment.
Thank you. Next is Betsy Weiland, followed by Ryan Ojekian.
Okay. Yes, my name is Betsy Weiland, and I also work on issues surrounding our waterways in Sacramento. I'm with Save the American River Association. And boy, do I appreciate the last couple of speakers, and I think that maybe was a lack today, is to talk about alternatives to just providing toilets that rely on water. Because there is technology that has been used around the world for many years, like composting toilets and things. So that has opened up a line of thought for me that we haven't had in our discussions. And I just want to say, and I hate to harp on this, but for those of us that are doing on the ground work, I mean, dealing practically every day with a problem, what would you say to somebody if, you know, providing more access to the toilets that are available to the public, like, you know, RT or restaurants even, or fast food chains. What would you say to a business owner that I do business with all the time, and they do business in a community that's challenged, but they want to be a good partner in their community, so that for years they've been allowing people in the community, homeless, to use their facility, their bathroom. Just recently, they posted a sign that said, "No public restroom anymore." And the reason being is because of the destruction. What would you advise a business owner who wants to be a good partner in the community, help the people that are in their community they do business in, but can't afford or can't deal with the destruction and the expense that happens? And we also see this when we try to design bathrooms with our parks department. And basically, we use the same standards that they use when they design facilities for prison systems. So that's the practical aspect of this. Outside of hiring people to stay with the bathroom as long as it's open to do what you suggested, Lava May, which I think does work ultimately, but it's not practical without funding or volunteers or whatever. So thank you very much.
So thank you. I do encourage conversation offline after we close.
But if there's a practical answer to the solution for that business owner.
Ryan Ojakian, followed by Roland Brady.
Yeah, thanks. Ryan Ojakian with the Regional Water Authority. RWA is a Joint Powers Association comprised of 21 Sacramento area drinking water suppliers. Our mission statement is to reliably provide high quality, affordable water, essentially the drinking water side of the human right to water. We have lots of conversations with the Water Board on that front. This is the first time that we've really delved into this arena. I don't think it's been said yet. I want to say thank you for bringing that up. It's a conversation, obviously, you're hearing in the comments that we need to have and explore in great detail. Also, thank you for the panelists for that same reason. I wanted to point out a couple of things and raise a couple of questions. The first thing is we heard that the Water Board is required to implement the human right to water, but part of that also is all relevant state agencies. And we heard that this is, there are a number of elements, so I don't want to oversimplify how we get to a solution, but at its first and foremost, it's ultimately the long-term end goal is to get those who are experiencing homelessness into homes. So there is a role in that context for us to talk to other state departments and agencies. The governor, has said on homelessness in the campaign that we've managed this problem for far too long and it's time to solve it. So while I appreciate the Water Board bringing this forward, I think we need to think about where the Water Board fits in that larger context and this larger context of sanitation. The questions that I have are, it was great to hear that we could get a 60% savings from resources that we're spending right now. But what is the larger cost and how do we tap into potentially those savings from the state or local sources that are currently funding those? So that's the kind of questions that I want to explore. And I'll talk to Laura a little bit more about her Prop 218 stuff because that is very interesting. But those were my comments, and thank you again for setting this up and looking forward to continuing the conversation.
Thank you. Roland Brady?
Yeah, my name is Roland Brady. I'm a geologist. I've been working on the American River Parkway for a number of years, and most of my energy goes into response to the homeless encampments that are along there and the impact that the camps have on not only the parkway itself and the habitat of the parkway, but on the ability of visitors to use the parkway for the intended use of the parkway. And the parkway is a nature preserve. And aside from the trash that's left behind, there are a number of documented impacts that the camps have, including segmentation of the natural pathways of organisms up and down the riparian corridor, soil compaction, the removal of understory vegetation, et cetera, et cetera. So I see a real difference between the needs of the homeless population in urban environments where there is hardscaping and the impact of that same population in these natural areas. And particularly with the passage of the Martin versus the city of Boise that says that illegal camping ordinances cannot be enforced any longer by states and by counties. I'm wondering, I see a real need for good, safe, sane places for people to go that have access to water and sanitation. And in my mind, I see transitional organized camps, but I understand that the emphasis really is on permanent housing, but that's going to take so much longer to provide rather than bivouac areas where people can go to and get the services they need. But without the ability to have a law that allows you to remove them from areas where they're causing clear and present and future damage, which is overruled by the Ninth Circuit Court decision, how do you actually enforce an organization, a move of people out of these natural areas into a clean, safe, organized camping environment if they don't want to go, but they're still causing these damages?
Thank you. So that's all the public comment cards I have. So I just want to say a few words in closing. I want to again thank everyone who came today, everyone who was on one of our panelists and shared their expertise and experience with us. You know, we hold workshops like this to ask questions, to dive deep, to think hard about roles and responsibilities, to think creatively about solutions and programs and policies. And we're not going to stop here. I think I certainly have heard a lot today that makes me think about certain next steps that the boards can take in terms of further discussions and evaluating and exploring some ideas that have been put forward. So again, I want to thank everyone for coming. This is a critically important issue to the state. It's enshrined in our duty per statute, and we're going to keep working on it alongside all of you. So thank you. We're adjourned.
And I want to thank Max and Mary for pulling it all together. All of our speakers, our panelists, all of you on the online. But thank you very much, Max and Mary, for pulling it all together. So thank you again.